meeting number 48 of the House of Commons Standing Committee on Finances. Will be our third panel today. Pursuant to Standing Order 108-2, the committee's motion adopted on Tuesday, April 27th, 2021. The committee is meeting to study the subject matter of Bill C-30, an act to implement certain provisions of the budget tabled in Parliament on April 19th of this year, and other measures. Today's meeting is taking place in the hybrid format pursuant to a House order of January 25th, 21. The proceedings will be made available on the House of Commons website. And just so that witnesses know, the webcast will always show the person who's speaking rather than the entirety of the committee. And we ask that screenshots not to be taken. So with that bit of introduction, we will go straight to witnesses. If you could keep your presentations to about 5 minutes, that'd be great. A little more time for questions. We'll start with the Canada's Building Trade Unions, Mr. Kersharen, Chair, and Mr. Strickland, Executive Director. I'm not sure who's taking the lead, but the floor is yours.
I am. Thank you very much. And good afternoon. And thank you very much for the opportunity to address you today on Bill C-30 and how the effect of the budget will have on the skilled trades workers in Canada. My name is Robert Kuchar, and I am the chair of the Canadian Executive Board of Canada's Building Trades Unions. The CBTU is an organization composed of 14 international unions with over 500,000 skilled men and women from coast to coast to coast. I am also the General Vice President of the International Union of Painters and Allied Trades, one of the CBTU's 14 affiliates. Today, I'll be sharing my time with the Executive Director of the CBTU, Sean Strickland. First of all, we are pleased to see the $30 billion allocated for National Childcare Program in the budget. Access to childcare remains an issue for skilled trades workers who don't fit typical 9 to 5, Monday to Friday work schedule. A large-scale investment of this kind is important to help working families, and we will continue to work with the government to ensure childcare means childcare for all workers. Overall, over 500,000 workers have been laid off or face cuts to the working hours due to the pandemic, and impacts which have disproportionately amongst certain segments of the population, including young workers, women, and racialized communities. And while the construction industry, which accounts for about 6% of Canada's GDP, has been a key player in keeping the economy going this past year, industry employment is down from pre-pandemic levels, with unemployment nationally at about 8% and much higher in certain regions of this country. The recent extension of programs like the Canada Recovery Benefits in the budget will help workers through this unprecedented time. Looking for longer term, we are pleased to see the reforms in the employment insurance program included in Bill C-30. This has been a high priority for the Canada's building trades and will be better support workers in the long term. We recently appreciate the opportunity to address HUMA committee on this issue, specifically allowing claimants to start EI benefits sooner by simplifying the rules around monies paid on separation, lowering the threshold for entrance requirements to EI, and very importantly, it's extending the EI sick benefits from 15 to 26 weeks. This will help all Canadians, including our members, who don't have access to paid sick days. We commend the Government of Canada for taking those measures into account in this bill. Thank you, and I will like to hand my remaining time over to Mr. Sean Strickland.
Thank you, Robert, and thank you very much to the committee. It's a real pleasure to be here today, and thanks very much for the work that you do on behalf of your constituents and all Canadians. We appreciate the opportunity to engage on Bill C-30 and look forward to continued consultation on budget items like the new apprenticeship service, the Community Workforce Development Program, and the Sectoral Workforce Solutions Program as those details get ironed out. Bill C-30 includes important measures to alleviate some of the financial burden on apprentices as they move through their apprenticeship by absorbing interest accrued from the Canada Apprentice Loans Program until March 2023. We applaud the government for this initiative. We also appreciate the budget's focus on green energy and workforce development, but recognize there's an opportunity to expand on additional investments as we look beyond the pandemic and getting Canadians back to work. In the construction sector, that means support for a skilled trades workforce mobility tax deduction. Currently on the floor of the House of Commons is Private Members Bill C-275. Unlike many careers, construction work is temporary in that you build a project, complete the project, and then move on to the next one. This can require workers to travel and temporarily relocate for work. Costs, which can be too much for a worker and disincentivize them to travel to where the work is. This can create labor shortages in different regions with high unemployment in others. A skilled trades mobility tax deduction would address this and transition workers from utilizing programs like EI and instead contribute to the Canadian economy through tax revenues from their employment. This past March, an independent financial projection commissioned by Canada's building trades unions found a Canada-wide implementation of a skilled trades workforce mobility tax deduction would save the Treasury an estimated $347 million annually through increased tax revenues and reduced reliance on EI and other government programs. This private member's bill will not receive royal assent, but we encourage the government to adopt this measure. This is very important to helping rebuild Canada's economy and to building trades members. There's a lot in the budget that will help to continue building Canada's skilled trades workforce. We need to ensure that the funds that have been committed in budget 2021 and previously for infrastructure investment flow out the door, put shovels in the ground, and get people back to work and faster. On behalf of the over 500,000 skilled trades professionals that belong to Canada's building trades unions and our 14 affiliated international unions, I want to thank the committee for this opportunity to present. I look forward to any questions that you may have for myself and Robert. Thank you.
Thank you both for that presentation. Then turning to Dr. Ann Collins, President, Canadian Medical Association. Dr. Collins.
Thank you, Mr. Chair. I am Dr. Ann Collins. Over the past 3 decades, I have taught family medicine, run a full-time family practice, served with the Canadian Armed Forces, and worked for 20 years in nursing home care. Today, it is my privilege to speak to you as President of the Canadian Medical Association, representing the sentiments and convictions of our 80,000 members. Since inception in 1867, the Canadian Medical Association has advocated for matters of national health. The pandemic has showcased the enormous strengths and tenacity of the professionals who are at work delivering the nation's health care. It has also shown us how quickly our resources can be overwhelmed. Our country's recovery hinges on the recuperation of our health networks, because economic security cannot exist without health security. Of the significant investments announced in Budget 2021, we are pleased to see the attention paid to better care for our older adults and communities most impacted. We can create a more dignified provision of care in long-term care facilities and support age-in-place strategies. We can address social determinants of health and invest in the battle against climate change. These commitments will fortify the equitable health security of Canadians. The CMA especially welcomes the federal government's commitment to provide the provinces and territories with $4 billion through a one-time top-up to the Canada Health Transfer. This will support health systems with the capacity to clear the backlog of delayed procedures from the first and second waves. Bill C-25 is the lifeline to Canadians' immediate health needs. It must pass without delay. Canada's job now is to address equitable access to primary care teams. 13% of the country lacks access to a family doctor or a family care team. That's an astonishing 5 million Canadians. Primary care is the front door of healthcare. It is affordable, it fosters equity, and it will be essential to support Canada through and out of the pandemic. but the door is broken and off its hinges. It's struggling to remain upright. The federal government has long expressed commitments to invest in the expansion of primary care, with good reason. Expanding primary care will help ensure every single Canadian has access to a family doctor or primary care provider. Every person in Canada, especially those most impacted by structural inequities, deserves the attention of a primary care team. At present, much of our care exists in a vacuum. One discipline is completely severed from another. We don't accept divisiveness in any other aspect of life. How can we accept it in our healthcare system? Primary care is a team-based model that is rooted in the networking of health professionals. They work in concert, just as a healthy body does. Primary care is the infrastructure with which to deliver mental health services and make virtual and remote care a reality. I think we can all agree that making a distinction between physical health and mental health is antiquated. The time has come to work towards parity in the resources needed to treat Canadians, regardless of their illness. The future of sustainable healthcare is housed in the success of primary care. Our younger physicians and physicians in training seek to practice under this model. It is the means that will prevent greater illness and further strain on our healthcare systems. This is the time to support the future of medicine, the future of care, the future of Canadians' health. The CMA appeals to parliamentarians to deliver this critical healthcare resource in Budget 2021. There's still time. An infusion of federal funds in the amount of $1.2 billion over 4 years would expand the establishment of primary care teams in each province and territory. We are equally intent on seeing an increase in federal funding for healthcare to the provinces and territories in the long term. It is the truest signal of collaboration. Mr. Chair, let me thank the committee for the invitation. The CMA is grateful for the opportunity.
Thank you very much, Dr. Collins. Turning then to, from the medical profession as well, the Canadian Nurses Association, Mr. Villeneuve, CEO, and Ms. Hamza, I might have your name wrong there, Ed, policy lead.
Thank you, Mr. Chair and committee members, for inviting the Canadian Nurses Association to share our perspectives on Bill C-30 and the 2021. And you're quite right, Mr. Chair, it is Hamza, Aiden Hamza. I'd like to acknowledge that I speak to you today from the ancestral unceded lands of the Algonquin and Anishinaabe peoples in Eastern Ontario. My name is Mike Villeneuve, and I'm the CEO of the Canadian Nurses Association. And I'm joined today by my great colleague, Aiden Hamza, who is our policy lead. Overall, the Canadian Nurses Association welcomes the important measures outlined in the budget to continue fighting COVID-19, to care for children, to protect older adults, expand broadband internet to support virtual care, and to tackle systemic racism. I'll focus my remarks on key issues CNA has strongly been advocating throughout the pandemic and how the budget addresses some of these concerns. CNA has been calling for a larger national conversation around aging to identify the best models to support safe and dignified aging in Canada. Since the beginning of the pandemic, we've all seen and some even experienced the devastating effects of the virus for older adults and how COVID-19 has put a spotlight on some well-known vulnerabilities in our healthcare systems. In our pre-budget submission and advocacy, CNA urged the federal government to lead the development of pan-Canadian standards and increase funding for long-term care. So we're pleased to see a commitment of $3 billion to support provinces and territories in ensuring standards for long-term care are applied while respecting jurisdictions. As referenced in the budget, the Health Standards Organization and Canadian Standards Association are launching a process to develop standards for long-term care. And while CNA welcomes this work, of course, we do continue to urge the federal government to take a leadership role and institute meaningful change by implementing measurable, actionable, and accountable standards to address the shocking outcomes we have seen. Furthermore, although Division 12 of Part 14 of Bill C-30 provides an important emergency $4 billion top-up to the Canada Health Transfer, more funding is needed to meaningfully support the health and social needs of the largest generation of older people in our history. As we shared with this committee during pre-budget consultations, population aging alone will drive increases in healthcare by an additional $93 billion over the next decade. So new, dedicated funding is critical to enhance the ability of provinces and territories to invest in home care, community care, long-term care, palliative and end-of-life care. And that is why CNA continues to call on the government to implement a new demographic top-up to the Canada Health Transfer, Lastly, as nurses continue to fight COVID-19, CNA was pleased to see that Budget 2021 pledged mental health supports dedicated to healthcare workers who are experiencing trauma due to COVID-19. More than a year into the pandemic, and with many provinces facing a dangerous third wave this very day, nurses and other healthcare workers are facing critical fatigue and burnout. We've been hearing stories about nurses and physicians and others planning to leave the profession, and we've seen major staffing issues in critical care units over recent weeks by the federal government will be crucial. Thank you, Mr. Chair, and my colleague Aidan and I will do our best to answer any questions. Thank you for including us.
Thank you very much to you both. Then turning to Curtis with Ms. Mrozek. You get the floor, Andrea.
Thank you very much, Mr. Chair. Every morning I work taking care of my 2-year-old. Every afternoon I work for Cardis, a not-for-profit think tank. The federal government thinks only one of these activities is worthy of federal support. Some afternoons my husband takes care of our 2-year-old, and other afternoons a paid helper does the same. Again, for those whose primary concern is increasing GDP, only the waged work contributes. But childcare is the care of a child, no matter who does it, and for the majority, gain and much to lose from plans for national daycare. I have researched childcare for 15 years, and today I'd like to comment specifically on federal funding allocations in light of the budget and a paper I recently co-authored called Look Before You Leap: The Real Costs and Complexities of National Daycare. Our detailed cost assessment phases in spaces for 70% of children under 6 over 5 years and includes staff, capital, training, and maintenance costs. All of our assumptions are based on the work of advocates for national daycare. However, there were several things they would desire that we were not able to include, making our estimates low. Our low quality and low cost estimate rings in at $17 billion annually, and the more reasonable estimate rings in at $36.3 billion annually. I'd like to make 3 points today. One is that the federal funding amounts are not enough to provide high quality childcare at low cost to all or even most parents. This program will not deliver what it promises. The second point is that if it funds only one kind of care, profit care, most parents will experience a loss of care options, increased childcare costs, or both a loss of options and increased costs. And finally, I'll talk about the per family funding amounts that could be provided were money allocated to children instead of to spaces. First, the funding levels are woefully inadequate for a high quality universal program. This level of funding guarantees low quality care, inaccessible care, or both. Our low-cost estimate is only slightly less than the federal budget allocates should cost sharing with the provinces actually materialize. But this estimate, the low-cost one, is based on the worst staff-child ratios in the country, those currently legally allowable in Quebec. To give context, those ratios allow 5 infants for 1 staff member. Do you know any parents of quintuplets who do not get assistance? Neither do I. This helps us to understand why these are poor ratios. Research shows poor ratios directly affect the quality of care for children. Our high cost estimate rings in at $36.3 billion. If the federal funding amount of $9.2 billion annually remains the same, this means the provinces will need to cover the gap. We itemize what each province would need to pay in the creation of a truly national daycare system in our report. In Ontario, this means covering 9.5 billion annually, in Alberta 3.4 billion annually, and in British Columbia 2.6 billion annually, to give 3 examples. It's likely that this new childcare cost-sharing agreement will land childcare in the same kind of ongoing political argument as other federal provincial cost-sharing agreements. For example, the federal budget 2021 did not provide the provinces with any additional health care funding despite the ongoing global pandemic and the requests of premiers. Second point, budget 2021 is not enough to provide a quality system, but it is enough to destabilize the existing ecosystem of care. Subsidizing one type of care at the expense of all others wipes out the other options. The significant decrease in parent fees in one part of the sector will inflate demand for that type of care. The provinces will struggle to meet the new demand, while other providers will be unable to compete. When Quebec introduced its provincial system, private care crumbled. A tax credit was provided about 10 years later to entice private providers back in, and Quebec is still dealing with some aspects of unequal access. After budget 2021 came down, private providers, who happen all to be female entrepreneurs, told us that they and their colleagues were working on exit strategies from their work, citing feeling unwanted or alternatively knowing they didn't want to be part of the government's plan. What is the cost of reestablishing care options when the existing ecosystem of care collapses? A government-created daycare space shortage is indeed the responsibility of government to fix, and it comes with its own price tag. Thirdly and finally, funding parents avoids the quagmire of low-quality systems that help the few and not the many. 9.2 billion annually as a per-child amount for children under 6 is almost $4,000 annually. I'll conclude by returning to the beginning with the idea that a family's unpaid time with their child or children is not work, not valuable, or offers no return. I think this is a short-sighted technocratic approach to childcare that fails to address Canadian families' wishes and needs. And there are fortunately better and more equitable and more efficient ways to meet those needs and simultaneously respect Canadian diversity. Thank you.
Thank you very much, Andrea. With the Chemistry Industry Association of Canada, Bob Masterson, President and CEO. Is Bob on there? I don't see him on my screen. All right, we'll come back to that one then with Green Economy Canada, Mr. Lloyd, Executive Director.
Mr. Easter, this is Alexander Roger. I think those witnesses are on the second panel.
Oh, am I looking at the wrong list? I am. My fault. This will be, sorry, Little Portugal on Dundas BIA, Miss Taborda, branch manager. Go ahead, my mistake.
Thank you. That's quite okay.
Too many panels today.
Of course, too many names. Good afternoon. My name is Annabella Taborda, branch manager of IC Savings Credit Union and chair of the Little Portugal and Dundas BIA, or Business Improvement Area in Toronto, Davenport Riding. Thank you for inviting me to take part in this call. Little Portugal and Dundas BIA represents a collection of approximately 325 small and independent businesses along Dundas Street West in Davenport. We are one of over 80 such organizations in Toronto whose entire focus is on the success and growth of local economies. Toronto's BIAs represent a diverse range of organizations with priorities that are defined by local business stakeholders. All funds raised by BIAs are reinvested back in their local communities. Over $1.4 billion have been paid in taxes by BIA members. And together, we employ over 151,000 individuals. That's a massive contribution and a huge responsibility for individual business owners. In my role as branch manager of IC Savings, a financial institution in Little Portugal, I witnessed the struggle of many small businesses during the pandemic and how COVID economic response plan and initiatives put in place by the federal government provided financial help, without which it would have been virtually impossible for our small business and independent businesses to survive. We have very few closures in our BIA, thanks to these programs and the ongoing work of our local MP, Julie Zarowitz, tirelessly advocating on our behalf and connecting with our membership to help guide them through available options. Thank you. And further, I also want to thank the federal government for increasing Canada's COVID-19 vaccine supply, which is vital to the recovery of our citizens and small businesses. We are encouraged by the number of proposed items within the budget 2021 supports for small business and look forward to their implementation. We do have some concerns, however, as to the timing, duration, and design of some of these initiatives. We are keenly aware that although the future is looking brighter, small business continue to suffer. Indeed, full recovery is still a long way off. An example would be CEBA. Although it is stated that if a business repays their loans by December 31st, 2022, up to a third of the value of the loans, meaning up to $20,000, will be forgiven. We know that even the deadline of December 31st, 2022 may still be too soon for our individual business owners to manage. Another example is Budget 2021 extension of Canada Emergency Wage Subsidy and Canada Emergency Rent Subsidy and Lockdown Support beyond June 2021 to September 25th, 2021. We believe this should be extended further because we must first take care of our small businesses to a livable state before we even consider setting upon any road to recovery. Helping small and medium-sized businesses move into the digital age, we applaud. The Little Portugal and Dundas BIA has been at the forefront of adoption of Toronto's digital Main Street program. We have been benefited from having a digital service squad member fluent in Portuguese, since in some cases, language was a barrier. Language challenges aside, however, we cannot force people to adopt digitally. The design of the Canada Digital Adoption Program must be carefully engineered with the understanding that many Main Street independent businesses are slow and unable to adapt for legitimate reasons, and some will need support in their native language. The program must be adept at uncovering the barriers up front and addressing them directly before the digital training can take hold and be effective in practice. We know this is the case because of the number of current businesses we have worked with who needed additional hands-on assistance with all government relief programs, subsidies, and initiatives, since only online access was available, and for obvious reasons. But again, we do applaud this initiative. New businesses. Part of the recovery will be welcoming new businesses in our BIA. We need these new businesses to create new jobs and replace any that may have been lost. We need all levels of government to create ways and means of helping us attract new businesses and helping sustain them in their first years as the country emerges from the pandemic. Proof of revenue loss criteria for government subsidies or relief program applications, for example, must be revisited to be more sensitive to a startup's reality. Accessibility. Approximately 1 in 5 Canadians, or about 6.2 million people aged 15 and over, report having a disability that limits them in their daily activities. That would include ability to visit Main Street businesses. The Accessible Act Canada Act was developed following the most inclusive and accessible consultation with the disability community in our country's history. More than 100 accessibility organizations and 6,000 Canadians took part in the consultations. What can be done? How can we prepare our population that continues to age to improve the accessibility of Canada's Main Street businesses? In closing, I'd like to say that as the government continues to develop COVID-19 recovery programs, we ask that our local MP representatives continue to actively engage us in their development. Our BIA boards and staff are highly skilled and adept at participating at identifying potential challenges amongst our membership and are only too happy to assist in any way we can. Thank you.
Thank you very much. I have Mr. Falk on as my first, the lineup for the first witness on this panel. Mr. Falk, Ms. Katrakis, Mr. St. Marie, and Mr. Julian. Rather, Ms. Zerowitz is the liberal one. Okay, Mr. Falk.
Good. Thank you, Mr. Chair, and thank you to all our witnesses for your testimony. Very interesting, and appreciate the different perspectives that you represent. Ms. Mrozek, in your presentation, you mentioned that you had recently co-authored a paper called Look Before You Leap, the Real Cost and Complexities of National Daycare. And I'm wondering whether you'd be able to submit that to the committee as a resource.
Yes, absolutely. We'll do so.
Okay, good. Thanks. You also, in your presentation, talked about how the implementation of a national daycare system would disrupt the existing ecosystem of what we currently have now for daycare. Could you expand a little more on that, please?
Sure. I turn to the example I cited in Quebec is what happened. So you saw the private providers leaving the industry as they couldn't compete and then being brought back in via a tax credit later on. But more specifically, right at this moment, there was an article in the Vancouver Sun, I believe, suggesting that the same thing is happening in British Columbia as they introduce their own provincial daycare plan. And so you saw there, in the words of the providers, childcare providers themselves, their concerns around viability of their businesses. One provider suggested that under the British Columbian plan, she would be providing childcare at a loss, and therefore it wasn't going to be worthwhile for her to continue. And so the call was for inclusion of all childcare in order to avoid that kind of situation.
Okay. You also mentioned that you have an interesting work schedule. It begins at home and you spend your mornings work looking after your children, and in the afternoon you have hired help that provide childcare for you while you go to work for Cardis. Would a system like a national daycare system help you in your environment or in your particular situation?
Well, the short answer is no, and I'm thinking of the people who live in the townhomes next to us with shift work involved, with unusual work hours, one father staying home, and grandparents being used down the street. These are all examples, myself included, of people who would be excluded from any benefit under the billions of dollars being allocated to a national child care system. So it's not an equitable way, is what I'm suggesting, of helping families who address their child care needs in many, many diverse ways.
Thank you. Yeah, and I think everyone on this committee, and I'm sure all Canadians, recognize the importance of childcare. And the finance minister, when she testified at committee and was asked about childcare, indicated that she also was privileged to be able to have had her grandparents offer childcare for her in her growing up years. And that's something a lot of folks across our country have, and that in this current program isn't being recognized or rewarded. And there are folks that legitimately need to have daycare services outside of family and friends. They don't have those connections or opportunities. And so we need to make sure that folks like that have options as well. But would you agree that that how parents decide to provide childcare for their children should be a parental decision?
Yeah, indeed, that's the viewpoint that we take. And I would point to statistics from Statistics Canada and other polls and surveys suggesting that cost is not the first issue that parents face, but where cost is a problem, the money that goes to parents would allow us all to make our own decisions and choices. And furthermore, a lot of us are prepared to sacrifice financially in order to spend time with family in these short-lived years when kids are growing up and won't be small forever. So what I see in the policy arena is what is echoed in my private life taking care of a 2-year-old, which is to say a lot of parents balancing and juggling in important ways to spend more time with their children.
Okay, so as an alternative to a national daycare program, could you provide maybe some alternative options that you might see as being more effective? Like, is something like an increase to the existing Canada Child Benefit? Would that be something more equitable, something that all parents would receive, and then they could determine how they wanted to spend those funds, whether they wanted to subsidize a parent working at home or provide family with some assistance for helping them, or take advantage of a licensed daycare? What would you think would be an alternative to a national system?
Definitely the money to parents is a more equitable and efficient way, but first we have to address the supply side issues. And to this, I would say that the Statistics Canada data that I've examined suggests that the supply is not as bad as we are told. And it is very diverse across the country as to whether that's an issue or not. Most parents are able to access the kind of care that they desire. And we have very recent polling data that suggests that parents are happy with the care that they find. And even after COVID, or in this stage of COVID, they are finding they've returned to their prior care options, and these can be a licensed space in a center, or it can be, as I do, home-based care or family-based care, or what have you. But the demand side is where the problems and where the choices are curtailed. If you don't have money to pay for what is available, then you don't have that choice. So I think that the money to parents is a viable option in increasing. And if it were means tested, then we would be significant amounts of money going to those who need it most. We suggested the $9.2 billion as a per child amount without the means test is roughly $4,000 per child under 6. But if we end up spending what I assume will be the case years down the road, upwards of $36 billion annually, then that amount is about $14,000 per child under 6. Again, that's not means tested. So I would advocate for means testing so that people who are truly in need can get the support to help them with their child care choices.
Last question, Ted.
Okay, I'd like to just ask Dr. Collins a question as well from the CMA. As you know, in budget 2021, it did not include an increase in health transfers to the provinces. And this, of course, is something that the provinces had been asking for. And we're really emphasizing how important those transfers would be. Could you discuss the long-term impact that this is going to have on our healthcare system?
Thank you for the question. In the context of the pandemic, what we don't yet know is what the full impact will be on wait times and on mental health needs going forward, for example. But we can safely predict that there will be an increase, a great need in increase in cost. And so clearly, there needs to be a collaborative approach between the federal and provincial governments in working on how best to meet those needs going forward in a system that was already challenged prior to the beginning of the pandemic.
Good. Thank you, Dr. Collins, and thank you, Ms. Mrozek, as well. Thanks, Chair.
Thank you to you both. Then turning to Mr. Zerowitz. Ms. Zerowitz will be followed by Mr. St. Marie.
Thank you so much, Mr. Chair. I don't mind being called Mr. I want to say huge thanks to all the presenters. Excellent presentation today. Because I have limited time, I'm going to start off with some questions to the Canada's Building Trades Union, then I'll finish off with the Little Portugal on Dundas BIA. So Mr. Coutrin and Ms. Strickland, I want to say thank you so much for your important testimony today and for your leadership right across our country. My first question to you is that there is a significant amount of dollars in budget 2021 invested in skills and training, including quite a bit of money around apprenticeship. Can you maybe speak to how important this is to helping with job creation and economic growth?
Sure.
Thank you.
Go ahead, Robert.
Thank you, Ms. Zerowitz. A couple of points before I hand it to Mr. Strickland. The items listed in the budget do a couple of things. One, it's put money in areas that are needed to stimulate the economy. That's one benefit. Secondly, it's intended in a lot of these initiatives to engage citizens that don't already participate in the construction industry. And I'm talking about Aboriginal people, women, and racialized communities and underrepresented communities. So that is very important. You know that our industry is going to lose through attrition many construction workers over the next 10 years, as reported by Build Force Canada. We need to backfill those members, and you know, besides creating opportunities for underrepresented groups in Canada, you know, with good paying careers, not just jobs, but good paying careers, that'll go a long way to backfill our workforce. But not only that, but build the economy. So it's going to help in a number of areas. And I'll defer to Mr. Strickland, please.
Thank you. Just briefly, just to add on to Robert's comments, and thank you very much for the question. You know, we're pleased to see the amount of dollars, significant amount of dollars towards training initiatives and apprenticeship for multiple sectors, not just construction, contained in Budget 2021. For construction, we need to attract more young people into the industry. We're an aging industry. We also need to attract more diverse groups in the industry. The average age of the apprentice in construction right now is 27 years of age. 20 years ago, it was 18 or 19 years of age. And so construction is often not the first choice of young people. We need to make it more of a first choice for young people and provide them with those long-term sustainable careers in construction through apprenticeship.
Okay, thank you so much. And then just one quick question. We know that there's been a lot of shortages within the trades and within the construction industry in particular. How can we reduce some of those barriers in terms of mobility for labor, maybe moving from one part of the country to another or for different parts, just to maybe fill in some of those demands? Only 30 seconds, please, because I have to go to the next questioner.
Yep, sure. The skilled trades workforce mobility tax deduction. Right now, construction workers aren't eligible under the Income Tax Act to deduct expenses for work-related travel, whereas salespeople are, professionals are. So you can have a sales professional go to a construction project, deduct their travel expenses, but the person who's installing the product that salesperson is selling is not able to deduct the same expenses if they have to travel the same amount of distance. So it is a very important issue for us, and we've been advocating long and hard for this issue. And we think that this inequity needs to be addressed to improve mobility for workers across Canada.
Thank you so much. I want to turn now to Ms. Taborda. Ms. Taborda, thanks for being here. You have a very unique role. You wear two hats. One is not only are you a branch manager and you're actually helping with emergency supports for businesses over the last year and a half, but you also are the chair of the local BIA. So you're actually helping to try to support our local businesses. So thanks for your important testimony and contribution today. You've talked about how the business supports, particularly the rent subsidy and the wage subsidy, have been lifelines, but you also talked about you feeling that it needs to be extended beyond what we're proposing in Budget 2021. How long do you think we need to extend it for?
Well, first of all, thank you for the question, and it is a pleasure being here. At this point, as you know, we're waiting to find out if we're going to come out of the lockdown, and this lockdown has created major issues because a lot of businesses have not been able to operate at all. Not even, there is no such thing as curbside pickup for a hair salon, for example. So even when they start, these people, when they do finally are able to operate, they have back rent that they have to pay. They have their staff that they have to pay. They have all sorts of bills already accumulated. And what we're looking at here is that we originally had considered that we would be out of the woods maybe in March, but it's now continued to drag on. So I would say that we should be looking or being prepared to look at this at least until the end of the year in order to give them time to be able to pay their debt without getting into further obligations.
Thank you. And then my last question to you is, you had talked a little bit about the Canada Digital Adoption Program, and you said this is very positive in helping local businesses digitize, modernize, and be able to be competitive moving forward. But you indicated that you would advise us on a number of criteria. So for us to be thoughtful about including some certain criteria as we move forward to implement the program, could you reiterate what that criteria might be?
Well, the main thing, as I indicated, is the language barriers. We have to be very sensitive to people that do not speak or don't have English like me as their first language. So every once in a while I slip into Portuguese, but I think I can get around pretty well. But I do have a lot of our membership that has issues, not just Portuguese, other languages as well. And if we are not prepared to sit down with them and explain it in their own language, it's going to be very difficult. Keep in mind, all of these people have Facebook, meaning they all understand technology. They just don't know it. Mm-hmm. And when you are able to bridge that gap and spend that a little bit more extra time, we are going to win and get them there.
Thank you so much.
Thank you. Thank you all. Going to Mr. St. Marie, who will be followed by Mr. Julian. Gabriel?
Oui, merci.
Thank you, Mr. Chairman. I want to start with a comment. I just want to talk a little bit about the daycare system in Quebec. We have our daycares that are provincially coordinated, and then we also have private sector daycare, so it gives a greater supply. Now, parents tend to prefer the not-for-profit daycares because they have skilled staff, people that have been to college for early childhood development, and so there is a program in place. So it is a range of services that are offered in Quebec, not just these not-for-profit centers. And we know that women can more easily get into the workplace, and this increases the number of women in the labor force. And we are very proud of our system in Quebec. But now I will turn to my questions. I have a question for Ms. Collins, and then perhaps for Mr. Villeneuve or Ms. Amsa, maybe they could add something too. So, Ms. Collins, do you feel that the federal government is providing enough financial support for health, or should there be more?
Thank you for the question. We are very pleased with what we saw with the introduction of Bill C-25 with the $4 billion one-time CHT top-up to address the backlog created by the first and second wave of the pandemic. But we know that there are going to be higher costs. As I stated earlier, it is yet unknown what the true cost of backlog will be with respect to the first, second, and third wave. We know that public health has been stretched by the pandemic and will need further support, and has already been alluded to the increased needs that Canadians will have around mental health care as a result of the pandemic. And beyond that, whatever the needs are of COVID patients going forward. So, and added to that is what we've mentioned is that there is no plan in Budget 2021 to address the implementation and ramping up, if you will, of primary care access, which really is so critical to meeting all those needs. It's thread throughout those. So there will be needed increased costs going forward. And we look very much forward, as I speak on behalf of the CMA, to being at those tables with federal, provincial, all levels of government in discussing how those needs can be met going forward.
Merci, Madame.
Thank you. Ms. Amsa or Mr. Villeneuve, do you have something to add on that?
Thank you very much for the question, Chair. I'll just add quickly, something different to add to what Dr. Collins said. We are just shy of 20% of our population being over the age of 65. And the Conference Board of Canada report, which I believe was commissioned by CMA, told us that we need an extra 20, there's going to be a 20% rise in costs due to aging alone over the coming decade. That's $93 billion. So while we certainly need funding to help stabilize systems coming out of the pandemic, we have a larger issue of what we're going to do with all those older folks. There were somewhere around 200,000 long-term care beds in the system in 2017, 2018. There was a shortage then of 63,000 spaces, people waiting, and the Conference Board estimates we need another 200,000. So unless we start to fund home care, primary care, as Dr. Collins said, palliative and end-of-life care, other services, we're going to be in trouble. And those people are old now. The baby boom is there now. So we're concerned that we must act. It's not a theory. It's real right now.
Oui,
merci. You get time, Gabriel.
OK, très bien. Merci beaucoup.
Thank you very much. And this shows the importance, as Mr. Villeneuve has just said, of taking into account the aging population that we have, so that perhaps we have per capita funding. Now, we had an announcement that the finance minister was going to meet with provincial counterparts, but after the pandemic. But it seems to me that in the middle of a public health crisis, that would be the time. So perhaps Dr. Collins or Mr. Villeneuve or Ms. Hamza, could you talk about this Premier's, the First Minister's Conference that might be held?
Thank you for the question. And again, we have outlined between Monsieur Villeneuve and myself the many needs that will be required by Canadians as a result of the pandemic, as a result of aging, and as a result of pre-existing healthcare systems prior to the pandemic. And again, we implore the federal and provincial governments to come together in a cooperative and collaborative fashion to discuss those needs, what we'll need to meet those needs moving forward. And we look to do whatever we can to engage and to support that collaboration.
Thank you. Thank you all. We will have to go to Mr. Julian, followed by Mr. Kelly. Peter?
Thanks so much, Mr. Chair. Thanks for our witnesses for coming with such compelling testimony today, and we hope that you and your families continue to stay safe and healthy during this pandemic. I'd like to address my first questions to Dr. Collins, Mr. Villeneuve, Madame Hansa, and our deepest condolences for the doctors and nurses that have died during this pandemic. The incredible bravery and dedication of Canada's nurses, of Canada's doctors during this unparalleled health crisis is something that I think all Canadians profoundly appreciate. And we know that many have given their lives. And our condolences go to each and every one of those members of your organizations and their families. Now, we had compelling testimony just in the previous panel that over $50 billion every year goes to the ultra rich and big corporations because of tax cuts, loopholes, a tax system that is simply broken down. Now, you've both, all three of you, have offered compelling reasons why we really need to prioritize healthcare funding for primary care, for long-term care, and the debacle we've seen there, for mental health care. Is it not fundamental that we prioritize healthcare funding and that we put in place a tax system so that everyone pays their fair share, so we actually have the wherewithal to put in place the funding for the needs that you have so clearly identified are absolutely essential to meet in the coming years?
Thank you for the question, and thank you, Mr. Julian, for your well wishes. Very gratefully accepted on behalf of the CMA. I'm not an economist. I'm not a tax expert, but I am a family physician. And I think that there is no question that the pandemic has fully laid bare the many deficiencies that exist in our healthcare systems. Again, 5 million Canadians without a family physician. In my province of New Brunswick and neighboring Nova Scotia, 100,000 people on a no doctor list. So I don't think Canadians are going to let this rest. The importance of healthcare. Healthcare is so critical. Good healthcare is so critical to a strong and robust economy. And so again, we applaud the government for the measures taken in budget 2021, and we look forward to honoring the commitment to primary health care teams, family physicians that are so critical to the life of a good healthcare system.
Mr. Villeneuve?
Yeah, thank you very much, Chair. I'll just add quickly, again, I'm also not an expert in what the tax system should be, but of course we would support fair, equitable tax system. I think that what we would put on the table is a reminder that we want to provide the best possible care for the best value. And much of what we do, many of the things we do, cost more than they need to. So if we think about those 63,000 people who didn't have a long-term care bed because there was only 200,000 and there was 63,000 more, it's not like they don't get care. They go to Emerge. They go to the hospital. When Dr. Collins is talking about people who don't have a doctor, they go to expensive places to get that care, and they're often sicker and it takes longer. So we believe that, a different sort of look at funding healthcare systems could ensure that we, in a sense, keep people steps back from moving to the more expensive places and use the tax dollars more wisely. I hope that's helpful.
Yes, it is. Now, I would like to come back to the issue of public universal pharmacare. That was a commitment that the government made in the last election. They've abandoned it in this budget and in this budget bill, as you well know. And the Canada Pharmacare Act was killed in the House of Commons a few weeks ago by the votes of government MPs. How important, because I know Canada's nurses were front and center in supporting the drive for public universal pharmacare, and there are 10 million Canadians that have no access to drug plans. How important is it to put in place public universal pharmacare just so that Canadians can actually get the medication their doctor prescribes and stay in better health and stay away from emergency rooms?
For the Canadian Nurses Association, it's absolutely essential. We've been talking about it for decades. And the concern is that it's even things like people, what do you call it, metering out their diabetic medications, for example, because they're so expensive they can't use them all effectively each day. We're particularly concerned that we've had a long focus historically on let's cover catastrophic drug expenses, AIDS drugs, and so on. But if you don't have $50 is catastrophic for you, right? If you're in that space. So it's really, really important, we believe, for people across Canada to tackle this and get pharmacare done.
Very quick answer this time, Peter.
Well, I'll ask the same question to Dr. Collins. Many doctors, of course, as well, have been extraordinarily supportive of public universal pharmacare. The bill was killed. The government has dropped the commitment. Do Canada's doctors believe it's important, essential to expand our healthcare system to include public universal pharmacare?
CMA supports federally funded essential medications as a start to be scaled up. There is no question that doctors and patients every day struggle to find the right medication at the right cost. And unfortunately, in some instances, the right cost is never achieved. And again, with loss of jobs during this pandemic, it's not just our seniors that are affected by this, but we're now seeing many younger Canadians having to make difficult choices about, do I buy my medications or do I buy groceries?
Okay, thank you. All going to Mr. Kelly in a 5-minute round, who will be followed by Mr. Fragaskatis.
All right,
Pat.
Thank you. I'll begin with Dr. Collins. I'd like you to have the opportunity to expand on something you said in response to one of Mr. St. Marie's questions. You talked about the funding to deal with the backlog of surgeries and healthcare caused by the first and second waves. But we're in a third wave that actually produced thankfully many more the people are surviving in the third wave, but spending a great deal of time in hospitals. So do you have better numbers or any kind of data on the backlogs that exist because of this third wave?
Thank you for the question, Mr. Kelly, and I do not have numbers for you. We did do our own study that said $1.3 billion to deal with the backlog of 6 procedures from the first wave alone. But so you can project and know that the cost of the second and third wave is going to be incredible. Doctors did scramble when there was fewer lockdowns to get surgeries taken care of, but it goes beyond surgery. We have seen patients delay their presentation to their physician if they have a family physician. We know that COVID patients who have
I really appreciate that, and thank you. I was if there was some information, I was hoping to get it, but obviously we still just don't know what this third wave is going to cost in that area. I'm going to go to Ms. Mrozek. We've heard at this committee leaders from a variety of different groups. We've heard from business and labor and academics, and there are plenty of pundits that support the principle of a national daycare system. And yet I'm really interested in the focus that you have done on researching what parents think of this type of system. And I wonder if you could elaborate on some of the questions that you put to parents, because it seems to me that there are so many different concerns that parents have, and they're different in different areas. No doubt, parents are very concerned about the cost of raising a family, which works itself out in a variety of ways, from housing to the cost of and availability of childcare. But what have parents told you about the kind of childcare that they want?
Right, thanks for the question. So we did actually do a recent poll with Angus Reid Institute asking about childcare needs amongst parents and Canadians at large. What we found was a diversity of responses, and that when presented with any array of policy options, parents were eager. They accepted each option with a high percentage. So for example, a refundable tax credit, yes, they're interested in that. Money to parents, yes, they're interested in that. National system, yes, they're interested in that. My point, however, is we didn't juxtapose the question of what a national system actually means on the ground, not in theory, but in practice, with actual dollar figures as per how much that would be for each parent, for each child under a particular age. And so we do attempt to ask what parents desire, and we faithfully represent what we find from our polling. There's a huge diversity of responses. I still believe that given the money now versus a pie in the sky type of system later on, parents would be more interested in money now, especially if I could refer to the point I mentioned before about the supply side issue not being as big a problem as we've been led to believe by activists for a national daycare system.
Right. I mean, and we see that the needs of parents are just extremely diverse, and you touched on that in your opening statements, and how no family, it seems, has the same approach or idea of how they would like to balance their family life and to ensure that the children are raised safely and comfortably and have the economic opportunity to participate in the workforce. So I'm just about out of time, but any further comments on the diversity of need that's out there?
Well, we believe parents are their best bet for their children, and they are capable and competent of choosing the right kind of childcare that works for them. And that could be a space in the center. It could be a home-based daycare provider. It could be a parent in the home, or juggling schedules, as our family has chosen to do. But again, to try to account for all of this diversity and then steamroll over it in a national system that inevitably is not going to uniquely address those needs strikes me as striking a real blow against what we call the ecosystem of care that does exist, is diverse, is very unique, and allows for families to work and care in the way that works for them.
Okay, thank you. Thank you all. Turning to Mr. Fragascatis, and then it'll be Mr. St. Maria's up. Peter?
Thank you, Chair. Thank you to all witnesses. Mr. Villeneuve and Ms. Hamza, very nice to see you both again. Mr. Villeneuve, in your testimony, you spoke favorably about the budget and its focus on, mental health. I do remember your testimony from many months ago when, this is back in the fall, when you also spoke about burnout that nurses were facing at that time as a result of COVID-19. You've mentioned it here again today. In light of both of those things, I think it's especially positive that the budget does have this special focus on mental health and supports that would improve mental health services in Canada. But I do want to ask you a question about nursing in general as a profession right now. How worried are you about the problem of burnout as a result of COVID-19? I'm assuming from your testimony that it's only become worse in the past few months. Where do you see this going?
Mr. Chair, is the member comfortable if I let Aidan answer that question?
Oh, yeah, yes, of course. Sorry, it was meant for either.
Whoever wants to go ahead, Aidan, you're on.
Thank you, Mr. Chair, and thank you for the question. We continue to be extremely concerned about the mental health of nurses. Throughout this third wave of the pandemic, we've seen a significant amount of stress due to the increased workload, the concern for personal and family safety, and the moral distress that nurses are experiencing. We're seeing a rising number, of course, of nursing vacancies across the country, and we've been hearing a number of reports of nurses who may also plan to leave the profession due to burnout. And I think it's also worth mentioning that as we talk about recovery and the backlog that was mentioned earlier, we will need a healthy workforce to help relieve us of that backlog of treatment. And we are pleased to see the investments made to support nurses and healthcare workers' mental health because right now, I think nurses, certainly across the country, from what we're hearing, are at a breaking point.
Thank you for that. I especially asked the question because where I am in London, Ontario, it's a healthcare community. We have two major hospitals serving not just the city, but the broader Southwestern Ontario region. So thank you for your advocacy on this. Clearly a very good step in the right direction, one that builds on, when I say step in the right direction, I'm talking obviously about the budget, but this builds upon previous investments that the government has made earlier in its mandate, but there's more to do in partnership, I think, certainly with the provincial governments. I do want to go to Mr. Kucharan. Sir, in your testimony, and it's great to see you again, and Mr. Strickland, I certainly remember our meeting that happened a few months ago. I hope you're keeping well. Mr. Kucharan, in your testimony, you outlined your view on national child care, how that will help your members. I wonder if you could expand on that. It's not automatic, I think, for most folks when they think about a national program like this, if it was to be implemented, that it could help so many in a variety of professions, including those in the trades. I wonder if you could go on and expand on that, but also look at the question as to whether or not this allows for greater participation in the trades. When there is these options in place, one would assume that attraction and retention challenges that are faced in the sector that you're representing could be addressed. I'm not saying it's a panacea, but it is a measure that I think could help. But I'd love your thoughts on that.
Thank you very much for the question, and you're absolutely right. The child care benefit program would allow more women to enter the trade, to open up spaces. Or to backfill the spaces that are through attrition that we're losing members from. Women in the trades right now make up, I think, about 6 or 7%, and it varies from regions across Canada. But that the percentage right now of women that are participating are very robust. We have programs to support that. And like everything else, they need support in terms of apprenticeship and skills training and skills upgrading. But that just means so much about getting more people into the trades and into the trades that have careers. Daycare is very expensive. When I was a young construction worker in downtown Toronto, my wife and I both worked, and one of our paychecks went to daycare, and that was 25 years ago, and that didn't include diapers. So that was a big hurdle to overcome. So this program will help the construction industry, will help in Canadians in general. And I'll defer to Sean Strickland, please.
Okay, I'm sorry, Peter, we're going to have to move on. I think we can get 6 more questioners on. Mr. St. Marie and Mr. Julian, 2 minutes. Ms. Jansen and Ms. Katrakis, 4 minutes, and Mr. Fast and Mr. Fraser, 3 minutes each. Mr. St. Marie.
Oui, merci, Monsieur Easter.
Yes, thank you, Mr. Easter. So my question is for Mr. Kucharan or Mr. Strickland. It has to do with Section 36 on amendments to employment insurance. I'd like to hear you on that topic. And a little earlier today, we heard Pierre Serret, a representative of the National Council of Unemployed, who was concerned about amendments, more specifically starting in September and for the following year, regarding the number of weeks covered and dealing with the rates of income that can be earned through employment insurance. It comes back to the status quo, and this could have a negative impact on seasonal workers. And I think that you represent certain trades that may have a seasonal nature. So I would like to hear your comments on that section, perhaps in connection with the comments of Mr. Serret. Thank you.
Thank you very much for the question. A couple of points I want to make, and the one about easing restrictions to get EI is so important. The lag time between you're laid off and when you can actually get your first paycheck is great, and that waiting period is a real challenge for construction workers. So we applaud the government for that initiative, and we support the government for that. Anything to reduce the barriers to entering EI is very important. But let me also touch on the EI sick benefits. We work with members who have use or misuse of substance abuse, mental health problems. We don't have sick days. So when we have problems like that, we don't get compensated, or we don't get a chance, or it's very difficult for us to get help. We often take painkillers or take substances that help us keep ourselves on the job, and that can lead to big problems with our industry. So with the government extending the period of sick days is very important, but also again, making it easier to get sick days. And I think that would go a long way to help not only our mental health, but also substance abuse.
Thank you. Thank you very much for that. And that's a really important point, Robert. Mr. Julian, followed by Ms. Jansen.
Thanks, Mr. Chair. Well, my question will go to Mr. Kucharan as well, or Mr. Strickland. And certainly a shout out to building trades members across the country, including my niece, Hannah, who has just started her apprenticeship training. So is excited to become part of the building trades across the country. Now, we know that we've got the pandemic, but we also have the looming crisis in the background, which is the climate crisis. The building trades issued a remarkable landmark report through the Columbia Institute back in 2017, Jobs for Tomorrow, Building Trades and Net Zero, where you called upon the government to make the investments required to create over 1 million jobs in that transition to clean energy. We haven't seen the government step up to date in any meaningful way, and this budget was a lost opportunity. How important is it that the government actually work with the building trades for the substantial investments that allow us to transition and create the hundreds of thousands of new jobs that come with that transitioning to a clean energy economy?
Let me just start out by saying our members, particularly in Alberta, are very concerned transitioning from the energy sector to other sectors. So the transition is very important to us. Secondly, we are working with the government to identify certain areas in the new economy, in the green economy, to support, develop, and invest in that will give us good jobs into the future, well-paying jobs into the future, and then transition existing members into those new industries. Mr. Strickland, please.
Just quickly, we're calling on the government to form a task force on the future of energy sector jobs. So we're going to do whatever we can to protect the existing jobs in the energy sector. There's a recent TD report that said we could lose up to 300,000 jobs between now and 2030 in the energy sector. So we want to protect the jobs that we have, but also position our industry for the future jobs in energy, small modular reactors, carbon sequestering, hydrogen, and we need to have a multi-sectoral approach to this with the support of the federal government so we don't leave these workers behind.
Thank you. Thank you very much to you all. Ms. Jansen for 4 minutes, followed by Ms. Katrakis. Tamara? You're muted, Tamara. Hit it. Kick that computer.
There you go.
Okay, you go. There
I'm
you
having
go.
a lot of trouble with it today. I don't know what's going on. I have a question for Ms. Morozek. I thought you hit the nail on the head in regards to $10 daycare when you said they will not be able to deliver on its promise, number one. And number two, we're going to get a loss of options. Now, it's been very clear already. They've done a pilot project here in BC, and they definitely did not deliver on their promise. We ended up having now the same amount of spaces, and just some people are paying less. And unfortunately, that tends to be those who are more upwardly mobile as compared to those who really need it. I wonder if you could talk to that fact.
That's been, the research has suggested that already in Quebec, that people of greater means are accessing the system on the backs of those who would most need it financially. And so I think there's various reasons for that, but ultimately, any kind of a system that fails to identify those who are truly in need and actually creates a benefit for people who are the least in need of it, I think strikes me as an inequitable way of providing childcare. We work with a definition of childcare that says that anyone who cares for a child is doing childcare. And so when you broaden out to look at the ecosystem of care, we don't have childcare deserts across the country. We have parents, family, ethnic communities, all kinds of different care options available, and they just aren't recognized by those who are strong proponents of a national daycare system. So I have very grave concerns about one homogeneous, universal style of system coming in and squashing the existing ecosystem of care.
Absolutely. I know the term homogeneous has been used quite a few times in regards to a number of the programs that the Liberals have put together. And I when I saw this one, I thought, my goodness, it must have been some elite male politician that put it together, because I know that women's schedules are so diverse. And when you look at this, it's like, I was speaking to a daycare here. He was talking about how some daycares, are open 8 to 4, others 7 to 6, and yet they were all pushed into the same square hole. Could you speak a little bit more to the fact that there's so many differences across Canada, and now suddenly we're going to try and squish everybody into the same box?
Yeah, that's definitely a concern that I have. And I actually have commentary from female leaders in the construction industry who have noted that the schedule of construction makes a universal program unfeasible for women, and what they actually need is something that's more agile and flexible. So whenever you work in a sector that is not 9 to 5, what we see in childcare center provision as a specific one form of childcare, they generally cater to a 9 to 5 work environment, which is at least a little part of the reason why it's inequitable and ends up funding people who are higher wages, because these tend to be office jobs. If you're in the sectors of retail and you have to do shift work after hours, this kind of care is not that accessible in centers right now, according to what I can see in the literature from across the country. So people doing work outside of the standard work hours are going to have a hard time, I think, accessing this low
so
cost.
What is the better way to tackle it then?
I truly believe that we can work with a realm of policy options. Refundable tax credits for those using childcare centers are something that could be tweaked in the provinces, be delivered more than just annually, which would provide financial relief to those most in need. I think that money to a per child amount allows for families to make decisions that work for them and recognizes that I personally don't believe that labor force participation ought to fall on the backs of the mothers of young children. I think it should be a choice that mothers make. And we have data to suggest that the majority of mothers prefer to work part-time or not at all. And it's a minority of mothers who prefer to work full-time. So when you look at that data, a coercive measure to push mothers of young children into the labor force isn't super helpful, and more that it would be better to be giving money to families so that they could choose.
Okay, I'm sorry, we're going to move on from there. Ms. Koutrakis, followed by Mr. Fast. Ms. Koutrakis, 4 minutes.
Thank you, Mr. Chair, and thank you to all the witnesses for being here this afternoon. As an MP coming from Quebec, I'm fascinated with some of the testimony that I'm listening to this afternoon on national childcare. If you want to talk about data and statistics, Quebec has probably the largest, participation of women in the workforce, and a lot of that has to do because of our childcare. And not only that, there's so many other jurisdictions that are looking to the Quebec model because it does work so well. If we want women to participate in the workforce, then we have to absolutely make certain that there's affordable daycare, safe, affordable daycare, and the Quebec model certainly demonstrates that that could be done. In fact, the U.S. is looking at the Quebec model to see how they can implement a similar program in their jurisdiction. All you have to do is ask one of my friends who her and her husband were transferred from Montreal to Toronto, and their daycare, instead of paying $10 a day, they're now paying $60 a day. So it'd be interesting to speak to families who have been directly affected just by simply moving from Montreal to Toronto, which I think is a great segue into my next question. Sean Strickland, it's nice to see you again. Happy to see you here. And so I'm just wondering if you could speak, or Mr. Kucherin could speak, on your support of the child care program, and how will a program like this assist your members?
Well, maybe I could just pick up. Thank you very much, MP Koutrakis. Nice to see you again. And if I could just pick up maybe on Robert's comments from earlier, the National Child Care Program, when you think of it, you don't naturally make a connection to construction, but certainly it will help with our efforts to get more women into the workforce. And I think you're right to point out that Quebec has the largest participation rate for women across Canada. It's because of the child care program. And so we support that, and we see that as something that will help attract more women into construction. I think the concerns raised around flexibility can be easily addressed, and having childcare centers that are open real early in the morning and late at night to accommodate for shift workers and so on. And the other thing is, just picking up on what I said earlier, is that we have a challenge attracting young people into the trades, and having access to good quality childcare will help us attract young people into the trades, because they're often concerned about how are they going to manage childcare when both parents are working, how are they going to manage childcare when someone's working on a construction project. And for example, in the big cities, construction shifts usually start at 6 in the morning and end at 2, so that the workers can get there ahead of traffic. And how are you going to handle childcare into that system? So I think the market will respond based on these concerns and provide more opportunities for women and more opportunities for shift workers and construction workers to get into the trades, for example, because they'll have assurances that safe, affordable, accessible childcare is there.
Annie, you got a minute for both a question and an answer.
Thank you for your response, Sean. My next question is to the Canadian Nurses Association, or it could be to Dr. Collins as well. In response to the budget, I know that the Nurses Association's organization has recognized the steps taken to implement a disaggregated data action plan to address inequalities in our society. Can you expand on the systemic inequalities in care and health outcomes faced by racialized Canadians? And can you also comment briefly on how the disaggregated data action plan will take steps to addressing these inequalities?
And it'll have to be briefly. Who are we going to? Mr. Villeneuve?
I'll let Aidan.
Okay. Aidan.
Thank you, Mr. Chair, and thank you for the question. You're absolutely right. The need for disaggregated data is long overdue. As you know, we cannot make any changes when policy or in healthcare without the data to support it. And we've known that these inequities have existed in health for Black, Indigenous, and people of color across Canada, and having the disaggregated data to then identify how we can reallocate resources is crucial. So very glad to see that moving forward, and look forward to continue to participate in those discussions.
Thank you very much. I'm sorry to push people to be fast, but we're down to 2.5 minutes for you, Mr. Fast, and 2.5 minutes for Mr. Fraser. Ed, you're on.
All right, thank you. My question is to Ms. Mrozek. Ms. Katrakis just attacked your testimony indirectly without leaving you with an opportunity to respond, but I did want to clarify something. I believe it's your position that a national childcare program should be means tested. Is that correct?
Any benefits should go to all families and all parents and means tested, so yes.
All right. Could you comment on timelines for getting a national daycare system implemented? Because we're talking about federal provincial negotiations that will take some time. We've had promises of national daycare, well, going back to 1993 and beyond, actually. In the meantime, this could take some years. Are you proposing something as an interim measure that could cover off the need that many families feel, the need for support, to provide them with some childcare support so that moms and dads can integrate into the labor force?
The paper we wrote is called The Cost and Complexities of National Daycare for a reason. It's not just a budgeting attempt of what national daycare costs. It leads you to discuss and consider all of the very significant complexities. There will be nothing easy and nothing fast about putting this in place, and there is no way that it will be available as a COVID economic recovery plan. So CCB, the Canada Child Benefit, is already in place. It exists and helps all parents already, and that's something that could be a useful tool in getting support to parents in need.
Did you want to have an opportunity to respond to Ms. Katrakis' critique of your testimony?
Only that there's plenty of peer-reviewed research that the U.S. is also considering by Canadian scholars of some repute, Baker, Gruber, Milligan, and Stephen Lehrer at Queen's University. It shows poor outcomes for children. Childcare is not about getting women into the workforce. Childcare is about the care of our youngest, and I think it matters whether they fare well in the type of care that they receive.
Okay, we are going to move on to the last questioner, will be Mr. Fraser, 2.5 minutes, Sean.
Thank you, Mr. Chair. That probably leaves me enough time for one question with a preamble. So here I go. Look, the number one issue that's been coming into my constituency office is a provincial issue, and it revolves around access to primary care. So my question is for our guests who have given testimony to that effect. I think, Mr. Villeneuve, you hit the nail on the head. These people don't completely go without care. They end up having delayed access to care. They go to walk-in clinics, they go to ERs. They end up getting care much after they need it when their condition is worsened, and it's been oftentimes delivered at a much greater expense to the taxpayer. So I'm wondering if you or Ann Collins could give suggestions on what the federal government can do to help expand access to family doctors and primary care providers. If you had one shot at this in the next minute and a half that you've got remaining, solve this problem for us, and I'll be forever grateful for your advice.
Over to you, Ann.
Thanks, Mike. Thank you for the question. A $1.2 billion transition fund over 4 years whereby provinces and federal government as well would look to expand primary care teams to look to see what communities need and to implement that. Our young doctors want to work in a team-based care model where there are nurse practitioners, nurses, social workers, home care experts. Our seniors need family physicians to have them stay in place at home for good primary care. This is the way forward. If you have a family doctor, you're lucky, but imagine what it would be like not to have a family doctor or a primary care provider team. And this is a model that has been shown to be effective. The Prime Minister has said primary care teams, we've got the answer and want to work collaboratively to implement that.
Mr. Chair, if I can, in 5 seconds, say thank you, and that I would invite a further conversation if you'd make yourself available offline.
Anytime.
Thank you.
Okay, look, a good point to end on. You people in the healthcare field, my wife is a retired nurse, and I get my ears burned every day. So good for your points. And I might say we heard your thoughts on Bill C-25, and we will put it forward as well, not before our committee, but before another one. In any event, look, thank you to all the witnesses. This was a wide-ranging discussion during this panel, as many of them are. Good questions, good responses, and that's what we like to hear. There's not always agreement, as you can see in this committee, but a good debate makes for better policy. So thank you very much. And for the committee, we will go to our fourth panel of the day right now. Thank you all to the witnesses again. Meeting is suspended for 1 minute.
Thank you, Chair.
Welcome to meeting number 48, the House of Commons Standing Committee on Finance. Pursuant to Standing Order 1082, the committee is meeting on Bill C-38, or the pre-study of Bill C-30, I should say, an act to implement certain provisions of the budget tabled in Parliament on April 19th and other measures. So we welcome witnesses here on the fourth panel of the day to hear their views on Bill C-30, and we welcome you all. With that, I might say that just so witnesses know that on the when you're speaking, the only person that is seen on the screen is the person who's speaking, not the committee and witnesses as a whole. So with that, we will start with the witnesses and try and hold your remarks to about 5 minutes. We'll start with Bonjour, Startup Montreal, Lilette Lamond, President and CEO. Floor is yours.
Merci. Thank you, Mr. Chairman, and thank you to all the members of the Standing Committee on Finance of the House of Commons for this invitation. My name is Liette Lamond, the CEO of Bonjour Startup Montréal. We're a non-profit organization whose mission is to improve the performance of the Montreal startup ecosystem to accelerate the creation, growth, and influence of startups in Montreal. The work involves a lot of partners, accelerators, incubators, investors, universities, big business, and governments. We were created in 2018 by the Osmo and Montreal Inc. Foundations. We were supported by the Government of Canada, the City of Montreal, various businesses, and we got a boost from Economic Development Canada in the fall of that year. We have launched a number of projects and services to fill some gaps that are due to the young nature of our startup ecosystem. Silicon Valley is over 40 years old. We are only 10 years old, and we have managed to reach a critical mass of startups. We have more than 1,300, but we need to get to the next stage of growth and enter foreign markets. That's crucial because that's where we see the economic and social benefits. So we would like to see more Lightspeeds and Shopifys to create wealth and provide experience. There is a race to create performing startup ecosystems, and this is not in Canada alone, but around the world. All major cities are investing in this. If Montreal doesn't move forward, it will be falling behind. The federal budget continues to provide support for small business through its emergency programs under the pandemic, and it earmarks significant investment for innovation. And we're very pleased to see that the government is focusing on innovation. Some measures are providing funding for startups, like the renewal of the venture capitalist initiative. We also have IRAP funds and measures that are very specific, like for women entrepreneurs and Black entrepreneurs. And there are measures as well to help clean tech, life sciences, aerospace, and artificial intelligence, which are important to Montreal. We are a voice for the startup ecosystem in Montreal, and we welcome the changes to the Small Business Financing Act, like increasing to 15 years the time for repayment of loans and a broadening of the loan categories. But we would be remiss if we did not mention today that we are concerned about the problem of underfunding by the federal government in the startup ecosystem in Quebec, and in particular in Montreal. We are in the 36th place in the world ranking, and Toronto and Waterloo are 18th and Vancouver at the 25th rung. There are very good Quebec startups, and they are often attracted by programs in Ontario to help them reach the next level, and that means we lose them. So we need to take comprehensive and quick action to make sure that we can reach the world level and remain in Quebec. We need a hypergrowth platform in Quebec and a scale-up platform that already exists in Ontario and gets $52 million from FedDev. It got that amount in 2019, and Vancouver is looking for $39 million to create a similar platform, and a new economic development agency has also been created in British Columbia. We don't have any scale-up program in Montreal or Quebec, but we have the same needs. Our ecosystem has gained momentum, and last week we had confirmation of that because the Montreal high-tech firms received $1.15 billion in total investment in 2020, which was almost as much as Toronto. But we need to move forward more, and we think that the federal government and Economic Development Canada are allies that need to provide more assistance. Thank you.
Thank you very much, Ms. Lamond. Turning then to the Canadian Chamber of Commerce, Patrick Gill, Senior Director, and Ms. Dregolo, Director, Parliamentary Affairs.
Good afternoon, committee members, and thank you for inviting the Canadian Chamber here today. My name is Ala Dragola. I'm the Canadian Chamber's Director of Parliamentary Affairs and SME Policy, and I'm also joined by Patrick Gill, our Senior Director of Tax and Financial Policy. The budget contains several good news items for businesses, including the extension of Qs and CERS, the enhancement of the Canada Small Business Financing Program, and the introduction of the new Recovery Hiring Program. These are all critical to helping keep businesses afloat during this ongoing third wave. But we are still missing an important piece of the recovery story, and that is a proactive, clear, and positive reopening plan. Today, I want to focus on two key recommendations for short-term needs. The first is in relation to the missing reopening plan. Earlier this week, the Canadian Chamber and 60 of our fellow business industry associations, including a few of my fellow panelists here, co-signed a letter to the Prime Minister calling for the federal government to work closely with the premiers to develop a clear and consistent pan-Canadian reopening plan, and for the government to work with officials in other countries to set benchmarks that would enable the easing of border restrictions and travel quarantines. A clear, forward-looking, and specific reopening plan is critical to Canada's successful recovery and must be an immediate priority for governments at all levels. Our second recommendation is in relation to the CEWS and CERS programs. Despite the good news in the budget that these programs have been extended, there is significant concern about the gradual phase out of these programs starting in July. With this change, businesses with more than 70% revenue losses will only receive a maximum of 20% subsidy for both their wages and their rent by September. Businesses in the hardest hit sectors, including tourism, travel, food services, and accommodations, will be the primary makeup of that group and will need a longer runway for recovery. Therefore, CEWS and CERS need to be maintained at their current respective 75% and 65% maximum rates through to the fall, and likely even beyond. The rent subsidy program also needs to be expanded to work better for medium-sized businesses and for those with locations in high cost of living areas. Beyond the transition from pandemic survival to recovery, a number of structural challenges remain that prevent Canada from reaching its full recovery potential. I will now pass it over to Patrick to speak to some of the Canadian Chamber's recommendations for Canada's medium and long-term economic recovery.
Thank you, Ella. Good afternoon, committee members. The budget contained many positive points for businesses seeking to recover from the pandemic. Its focus on growth and jobs is an important step towards economic recovery. Yet our country's drivers of growth will need to shift from public to private spending. Our businesses from Main Street to C Street are seeking a clear and predictable plan to help them lead Canada's economic revival. Businesses are ready to kickstart our shared recovery, but they need the government to do its part in creating an encouraging business environment. We must collectively become growth-minded when the pandemic ends, avoiding our historic 2% growth trap. While 2% reduces the federal deficit, it allows federal debt to grow and constrains opportunity for all. There are several aspects of the budget that could be improved to spur Canada's economic revival. First, unlocking business investment for recovery and job creation. For instance, while the budget moves forward with the acceleration of capital cost allowance deductions for Canadian-controlled private corporations on a temporary basis, the measure should be extended to publicly traded firms, as is typical under the CCA system. This, for instance, would help marshal the broadest scope of business investment. Second, the government should be more ambitious in its approach to fixing Canada's costly and burdensome regulatory environment. Moreover, it should be cautious in how and when it adds new complexity to its regulatory frameworks. For instance, the proposed new regime for interest deductibility is one example of adding new complexity onto existing complexity. Finally, moving towards a fiscal anchor rather than fiscal guardrails is warranted to guide and control expenditure choices. With significant spending committed in the medium term, a fiscal anchor would help impose discipline over fiscal policy decisions for the long term. Public debt can never be permitted to put public services at risk. Left unmoored, public debt risks being caught up by inflationary and credit pressures. Again, thank you very much for having us here today. We look forward to our discussion with you.
Thank you. Thank you to you both. And yes, we've seen your letter to the Prime Minister. Turning to the Canadian Federation of Independent Business, I believe, who also signed the letter. Dan Kelly, President and CEO. Welcome back, Dan. Yes, get your headphones on, or we will be giving you the gears.
My apologies for not being better prepared.
You're on. Go ahead.
My apologies for not being better prepared, Chair. Ontario just moments ago announced another 2 weeks on top of another 2 weeks on top of another 2 weeks of the lockdown in Ontario. So I was just blasting the Ford government seconds ago. But let me switch gears to the federal budget. There is a lot in the budget that we commend and endorse, and some pretty serious gaps that I want to highlight. I did send through the clerk in both French and English a slide deck of some data from CFIB, as I have several times to Finance Committee, just to give the latest on where small businesses stand. Right now, at this late stage, 14 months into the pandemic, only 51% of small and medium-sized firms across Canada are fully open. 51%, pretty serious situation. And if you look at the normal levels of staffing, fewer than 40% of businesses have attracted back all of their workers at this stage, in most cases because they do not need them as they are locked down. Most worrisome of all, only about a quarter of small firms are actually at normal or better levels of revenue than they were at this point before. So they're only a quarter of small businesses are at normal levels of revenue. I want to share with you that some of the measures that we did like in the budget, it did do several things. It allowed small business owners the deduction of up to $1.5 million is a very positive measure. We're quite pleased to see that the government did include that. That was a surprise and a positive one for business owners across Canada. There's a reference to further progress in reducing credit card processing fees, also something that we're quite pleased with. That is good news. Beyond that, we were pleased that with the extension in the rent and the wage subsidy until the fall. I will note, though, that there is great consternation right now about the planned reductions in the summer months of the subsidy levels. I want to remind this committee that the rent and the wage subsidy automatically adjust depending on the level of business losses that one is incurring. So the subsidies aren't there for businesses that are not in serious jeopardy, but there are so many businesses, especially given that we've got ongoing lockdowns, renewed lockdowns, and fresh lockdowns in Nova Scotia, Manitoba, that are really worried about the reduction in both Qs and in CERS that is intended. We did like the new Canada Recovery Hiring Program. That new hiring incentive, we believe, is a real positive and compliment the government for listening to the advice of my organization and others that have called for such a measure. We believe that it will be a way to help wean businesses off of the wage subsidy and allow it to be eliminated over time. But our overall advice is that governments really can't start to withdraw these subsidy programs until such time as governments themselves, federal, provincial, and local, can tell Canadians that it's time to go back to work, time to return to the office, time to go dining and travel, including with an open border. One of the other measures that does worry us, and one thing I just do want to highlight, for Liberal MPs on this committee, I urge you to get the message to Minister Freeland, the Deputy Prime Minister, to the Prime Minister, that the government needs to make good on the promise that the Prime Minister made to new business owners in May of 2020 to deliver support. That was something that I know Finance Committee has talked about already, but that hasn't happened. It's a year into an emergency program, and I believe deeply shameful that the government has not moved to allow new business owners to gain access to the wage and rent subsidy. That needs to be fixed. The rent subsidy, while working well, also sadly excludes thousands of business owners, as it does not include those that have a holding company and an operating company. Even the previous SECRA program had a fix for that, and this one does not. So we've made a series of recommendations. The other big worry that we have right now is the rising levels of debt on the books of small and medium-sized businesses. They have, on average, $170,000 in COVID-related debt to deal with. We urge government to consider increasing the percentage, increasing the amount of the CEBA loan, increasing the percentage forgiven to 50%, adding a forgivable percentage to the HASCAP program. These are some of the ways that we'll be able to lift some of the debt burden that businesses are facing and helping them into the recovery. Lots more to unpack, but I'm happy to do that over questions. Thank you very much, Chair.
Thank you very much, Mr. Kelly. And we'll turn to the Chemical Industry Association of Canada, who I introduced in the last panel, but you weren't here, Bob. Welcome to Bob Masterson, President and CEO, Chemical Industry Association of Canada. Welcome.
Thank you, Mr. Chair, committee members. My apologies, this was the time I was assigned. I am pleased to be with you on behalf of Canada's chemistry and plastics manufacturers combined. That's nearly an $80 billion a year industry in Canada. It's your third largest manufacturing sector. And most importantly, it serves all of your other important economic sectors, be it mining, forestry, automotive, aerospace, agriculture, agri-food, to name just a few. With respect to Bill C-30, the Budget Implementation Act, we offer three comments for you. First, our chemistry and plastics sectors have been resilient. And for the most part, a little bit uneven, but for the most part, companies had already recovered or nearly recovered to pre-COVID levels by the end of 2020. And due to a wide variety of factors that have had the winds at the back of this industry in Canada this year, the sector is showing significant growth through the start of 2021. Nevertheless, there are many other sectors, and we've just heard from Mr. Kelly and others, and other households, Canadian families and businesses that have not had the opportunity yet to recover or participate in this recovery. And this budget will play very important roles in providing a supporting floor as the recovery takes hold in these more challenged sectors of the economy. Second, I think there was a strong message in the budget that the challenge of a circular and carbon net zero economy, it's truly daunting to comprehend. But in many areas, this budget does propose substantial early investments, which will send strong signals on the direction business and society must go in the coming years and decades. Thirdly, though, I do have to point out that those signals alone are not sufficient. And Mr. Gill's already talked about this. But achieving a circular and a net zero economy is going to require a complete recapitalization of the Canadian economy. Government expenditures alone will never be able to get the job done. If you look at our chemistry sector alone, I don't have an exact number for you, but it will be well in excess of $100 billion, probably over $200 billion to recapitalize the current industry we have to allow it to transform for a circular and net zero economy. Only the private sector has the ability to allocate resources at any scale approaching that. And from our perspective, that's where the budget fell short and that we believe more attention is urgently needed. Make no mistake, global supply chains will recapitalize. They will be transformed completely for a net zero and circular economy. The only question is whether Canada's industrial and economic sectors will be able to participate or will just continue to be a flyover destination for the much needed global investment. The experience in our sector, I've talked to you folks about this a number of times, is a case in point. South of the border, we've seen $300 billion of new investment in the last 7 years. By historical measures, we should have seen 30 billion of that in Canada. We've seen just 7. And yes, COVID certainly delayed some investment activity south of the border and globally, but some of those trends I talked about are pointing that the sector is already looking tight. And I think you can expect to see some global announcements for new investments, including in the United States, in the weeks and months to come. At this point, however, I'd have to say another round of investments is probably not on Canada's radar, and we don't believe the budget offered anything to improve the chances of attracting that investment in the near future. So prior to the next budget, we urge the committee to make further recommendations to underline those that you've placed before to focus on improving Canada's investment climate. One of them also already discussed is certainly the 100% accelerated capital cost allowance that was introduced in the fall economic statement previously. Recall that's a temporary measure. Its clock's already running. Companies that had to go on hold for 2 years because of COVID, they now can't take advantage of the full allowance that you put in place for them. We'd encourage you to, at a minimum, extend that out to 2030, a full capital cost cycle. And if that's not sufficient, we'd certainly encourage you to make that permanent, like south of the border. Secondly, please, we have to recycle these carbon revenues back into the industrial sectors. We can't take hundreds of millions, if not billions of dollars out of the productive economy, send it elsewhere, and then expect the same sectors of the industrial economy to somehow magically come up with these hundreds of billions of dollars to invest in the recapitalization. It's not going to happen. We have to find a way to get the revenues back to allow for that investment. And third, you've heard me say this before, again, as much as the federal government and provinces have collaborated for the benefit of all Canadians throughout this COVID pandemic, we need equal shared and collaborative attention to building a sustainable investment climate that will attract global capital and retain Canadian capital in this country so that we have a chance to succeed in this transition to a circular and net zero economy. I thank you once again for this opportunity to be with you today. Thank you, Mr. Chair.
Thank you very much, Mr. Masterton. Turning then to Green Economy Canada, Ms. Lloyd, Executive Director, the floor is yours. Welcome.
Thank you. Thank you very much, Mr. Chair and members of the committee. I appreciate the opportunity to appear today, and I'm pleased to be joining you from Waterloo, Ontario, traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Green Economy Canada is a national nonprofit that supports a network of green economy hubs in communities across the country. These hubs are engaging 300 businesses of all sectors and sizes to take action on climate change while increasing their profitability and overall competitiveness. 85% of the businesses engaged in our network are small and medium-sized enterprises, a segment of our economy that, as you know and others have said today, have been really hard hit by the impacts of COVID-19. There has been a big spotlight on the importance of small business throughout this pandemic and what's needed to help them survive. The perspective that I'd like to share with you today is that we need to be thinking more broadly about the supports to small business, specifically how we are helping them to build back in a way that prepares them to thrive in the transition to a net zero future. We know that climate change poses significant threats to the business community and that globally there is a $26 trillion economic opportunity in making the shift to net zero. Overall, we're pleased to see that this budget makes significant investments to address climate change, with $17.6 billion allocated towards a green recovery. Investments will help to decarbonize heavy industry, spur clean tech manufacturing, support agriculture, and help thousands of households to reduce their energy consumption. These investments are important and a step in the right direction to put us on a path to meeting our climate commitments, but they're insufficient to get us all the way there. One notable gap in the budget were investments targeted at small businesses, specifically to help them green their operations. SMEs make up more than 99% of businesses in Canada. They employ 9 in 10 private sector workers and contribute more than half of our GDP. Yet despite the vital role that small businesses play in job creation, innovation, and the vibrancy of our communities, they have been chronically overlooked in how they can help Canada achieve its climate action goals and how helping them to green their operations can boost their competitiveness. The reality is that we can't have a strong economy without a strong small business community, and we won't have a strong and resilient small business community if we're not helping to prepare them for the needs and opportunities of a low carbon future. The budget included tax incentives for businesses generally to adopt clean tech and for small businesses who manufacture clean tech. These measures are welcomed, but they will do little to benefit the majority of businesses in Canada who fall outside of heavy industry and clean tech manufacturing to green their operations. Without dedicated investments to support small businesses to reduce their emissions, this critical segment of our economy risks getting left behind and will find it difficult to adapt to important regulations like a $170 per ton carbon price by 2030. Moreover, we know that reducing emissions often leads to business benefits like reduced operating costs, increased sales, and an increased ability to attract and retain the next generation of employees who want to work for companies that are aligning profits and purpose. Based on feedback from our network and our own experience with previous climate action programs, we urge the Government of Canada to invest directly in incentives and support programs that can help small businesses to reduce their emissions and build sustainability into the core way of operating. We hear time and time again that many small businesses are concerned about climate change and want to do their fair share, but they need more direct support to overcome the very real time, knowledge, and financial barriers they face to doing so. Some measures that can help include developing a small business-focused retrofit program to provide incentives that reduce the upfront capital costs of undertaking energy efficiency projects. These programs need to be well-resourced and designed with small businesses in mind so that the application processes are simpler, the project thresholds are smaller, and the turnaround time to be told if they received funding is quicker. To reduce the time and knowledge barriers small businesses face, we need to make it easier and more financially affordable for small businesses to access third-party support to help them figure out what short and long-term actions they should be taking. Our green economy hubs offer this kind of support to businesses, and so we've seen firsthand what a big difference it can make to helping them undertake this sustainability work. Lastly, investing in training and skills development for existing staff and small businesses to understand where their emissions come from and how to change their operating models to decouple growth from emissions will also be critical. Small businesses don't have the in-house sustainability teams or specialized sustainability staff, and so that large organizations have. And so helping employees build their internal knowledge and skills for the green economy will be really important. I'd be happy to speak further about any of these recommendations in the Q&A. So in closing, I wanted to applaud the federal government for its commitment to climate action and making significant investments that can drive a green recovery. However, to ensure that our economy thrives in the transition to a net zero future, we cannot forget to invest in small businesses to do their part. The support we provide to small businesses now will determine not just Canada's ability to meet our international commitments, but if we are successful in setting the vast majority of businesses in Canada on a path to a stronger and more resilient future. Thank you.
Thank you very much, Ms. Lloyd. Just for committee members, the lineup on the started questions will be first Mr. Fast, Ms. Koutrakis, Mr. St. Marie, and Mr. Julian. And we'll turn to our last witnesses, Restaurants Canada, Mr. Bourbeau, Vice President Federal in Quebec, and Mr. Elliott, Senior Economist. I'm not sure who's leading off, but the floor is yours.
Thank you very much. I thought that you forgot about us, but that's good. That's a good idea to keep restaurants as a dessert. There you go. So I'm Olivier Bourbeau, Vice President and Federal in Quebec Affairs at Restaurants Canada. I've also brought along Restaurants Canada Chief Economist, Chris Elliott. He's going to participate in the Q&A. Our association represents a $95 billion industry made up of more than 98,000 establishments from coast to coast to coast, who serve about 22 million customers every day and contribute to 4% to the country GDP. At least this was the case before the COVID-19 pandemic struck. We estimate that at least 10% of our restaurant operations across the country have had to permanently close down due to the ongoing economic and public health crisis. That's about 10,000 establishments that are now gone for good. Here's a stat that's even more concerning. According to the April Labor Service survey from Statistics Canada, more than 2/3 of the 500,000 jobs that were lost during the pandemic and are still missing from the Canadian economy are from the food service sector. The measures contained in the long-awaited budget we're discussing today are not only of vital importance to the survival of the rest of our hardest hit sector, but they're also key to ensuring that restaurants have what they need to continue feeding Canada's economy recovery and bringing Canadians back to work. Restaurants and the many small and medium-sized businesses that make up the Canadian food service sector are an absolutely critical pillar of our culture, economy, and local communities. Something that most Canadians do not realize is that at least 95 cents in every dollar we spend at a restaurant usually goes directly back into our communities. That's because even during the best of times, a typical Canadian restaurant has a pre-tax profit margin of less than 5%. No other sector keeps so little in profit and returns so much to our economy. 95% of all restaurant revenue typically goes toward local jobs, purchases from Canadian farmers, food and beverages producers, and other food service industry suppliers, contributions to charity, and more. Unfortunately, COVID-19 pandemic has stretched their resiliency to the limits. Given the exceptional challenges still facing our hardest hit industry, we are calling for sector-specific restaurant survival support package. Our key recommendations are, first and foremost, an exemption from the scheduled phase-out of the rent and wage subsidies for the highly affected food service sector, and an extension of these vital programs for restaurants until at least April 2022. This extension is needed as our survey data has consistently revealed that restaurant operators expect they'll need at least a year to return back to profitability. We're also asking for the option for any restaurants eligible for the wage subsidy to be able to apply for added funding through the Canada Recovery Hiring Program so that they can hire new workers in addition to keeping the ones they already have on payroll with the wage subsidy. Our members also tell us they need partial forgiveness for all government-backed loans and an extension of application deadlines for existing programs. Currently, loan forgiveness is only available through CEBA. We would like to see this as well for HASCAP and any other loan program that the government introduces to help business recover from the pandemic. Restaurant operators simply can't afford to take on any more debt to pay for the debt they've already had to incur to pay for previous pandemic debt. Finally, our hardest hit industry needs tax credits to defray the significant costs they've incurred from COVID-19 health and safety expenditures over the course of the pandemic. Our survey data has shown us that 8 out of 10 food service business have been operating at a loss or barely breaking even throughout the entire pandemic. In fact, nearly half of all restaurant operations have consistently been losing money for more than a year. This was the case even after dining rooms reopened across all jurisdictions last summer, and even once the federal rent and wage subsidies and other forms of government support became available. Essentially, these emergency aid subsidies have been providing our hardest hit industry with vital needed life support. Even with Canadians now looking forward to hopefully enjoying a one-dose summer, we know this won't mean restaurants can operate at 100% capacity. We expect physical distancing requirements will remain in place throughout the summer at least, and maybe even into the fall and winter. Probably even more in Ontario, we never know. We appreciate that the government has listened to our industry and is extending the critically necessary rent and wage subsidies beyond June. This was an important first step in this budget. If this budget is implemented without any change, we are essentially pulling up the support ramp right before we launch and putting half of restaurants at risk of being left behind. Losing half of restaurants would not only be a huge loss for our main streets, we would also be leaving nearly 500,000 Canadians without work. Restaurants are key to bringing these jobs back, but we need the government supports to help us to get there. Thank you very much for your time, and I look forward to answering your question you may have. Thank you.
Thank you very much, Mr. Barbeau, and thank you to all the witnesses for their presentations. We will start with 6-minute round. Mr. Fast, followed by Ms. Petrakis. Ed, you're up.
Well, I'm going to go directly to Ms. Dragola and Mr. Gill. I believe I heard you reference the fiscal anchor. I think it was Mr. Gill. If you could just repeat your comments on that. Yes.
Yes. We're suggesting moving towards a fiscal anchor rather than a fiscal guardrail is warranted to guide and control expenditure choices over the long term. We recognize that the pandemic caused governments everywhere to shoulder more debt so that people and businesses didn't have to. Let's all remember. Thank you.
Right. Are you aware that Minister Freeland has actually claimed that her budget did contain a fiscal anchor? It's one that effectively has no targets. It's sort of pinned to a trajectory, but in fact, some have called it a floating anchor. Would you concur with her assessment or disagree with her that the budget contains a fiscal anchor?
The budget provides fiscal projections in the near term.
No, not projections. I'm talking about a fiscal anchor as you've defined it yourself.
No, the budget does not contain a fiscal anchor. It contains what we characterize as fiscal guardrails and projections over the near term.
Okay, thank you for that clarification. I'm going to go to Mr. Kelly. Dan, I've never heard you sound so exercised about an issue, and that was how this government has shamefully treated new businesses. Now, you rarely go out on a limb like that, so obviously this is something that represents a bit of a betrayal on the part of the government. Could you just expand a little bit more why this is so important to new businesses?
Thanks very much for the question. Yes, it is. You know, I've been telling small new business owners who have been contacting me in huge numbers to just stick with it. The government is serious about this. The Prime Minister himself promised to do something for new business owners back in May of last year. A full calendar year later, during a worldwide pandemic, the government has not moved on this measure. Meanwhile, provincial support programs, many of them admittedly with tons of problems, most of the provincial programs from the NDPs in British Columbia to Conservatives in Ontario have fixed this issue and have allowed access to new business owners. It is more complicated, but it's not impossible. And we've laid out several ways that the government can do that, removing the requirements for a business number before March 1st, a payroll account number before March 1st. If they don't have a comparable month, a comparable month in 2019 because they weren't around in 2019, allow them to at least compare against the industry average, say for a restaurant in Manitoba, and use that as the amount to get the subsidy. These are businesses not that set up, not just set up with the full understanding of the pandemic behind them. These are business owners that often started in 2019. Some of them have laid out $400,000, $600,000 to invest in a brand new 100-seat restaurant. Was supposed to open in March 2020, delayed because of pandemic restrictions till June, opened with a trickle of business income, and have not had a nickel of federal support despite the Prime Minister's personal commitment to do that. That's why I'm so unhappy about this.
Thank you for that clarification. Bob Masterson, the Chemistry Association, good to have you here. It's nice to see you again. You focused on foreign direct investment, the fact that we're lagging behind. We're not going to be attracting the kind of investment that we should be expecting. And the budget doesn't actually do much to change that environment. Can you expand a little bit more on what you would expect to see in a budget to re-attract investment from abroad, to re-energize your industry here in Canada?
Yeah, thank you. And to clarify, it's not just the challenge of attracting foreign capital into Canada. As we saw in the earlier Barton report, not that many years back, we also have a problem with the outflow of Canadian capital. Canadians aren't investing in Canada, nor are global investors. That is the crux of the problem. I think we were very surprised, sir, that there wasn't even a message that the capital cost allowance that had been in place would be extended at least the 2 years covering this pandemic. Because again, you're set up, if you've got a 7-year window for one of these large plants that you're about to build, and suddenly you've lost 2 years, well, you can't count that time in the business case when you're trying to go to your investors and say, here's why we should invest in Canada. As we know, south of the border, accelerated capital cost is a permanent measure. It's not a temporary measure. It doesn't have a finite window. So it's not a matter of, treating Canadians even better than elsewhere. At a minimum, let's at least match the closest competition we have, and that's the United States. So very positive message and measure to have put the accelerated capital cost allowance in place through that earlier fall economic statement. But we don't get the benefit of that because of COVID. We had soundly expected that would get acknowledged, the benefit would be extended. We'd encourage that to be done with haste, and even again to relook at the idea of making this permanent. As you know, sir, anything that reduces the upfront cost of capital is a winner when it comes to attracting investment, and that's a really important mechanism. Thank you.
Okay, we are going to have to move on to Ms. Katrakis, followed by Mr. St. Marie. Annie?
Thank you, Mr. Chair, and thank you to all our witnesses this afternoon. My first question is to Bob Masterson. Bob, it's really nice to see you again, and thank you for your testimony, your thoughtful testimony, and very thoughtful critique of the government, because, in order to, amend policies, we need to have this exchange. So thank you for your honest testimony. Your organization has said that this budget sends important signals and provides foundational fiscal supports for the future direction of the Canadian economy as it transitions to net zero emissions. Can you expand on this statement and comment the budget items that work toward a net zero future?
Well, Ms. Lloyd articulated the total amount. Her number was much higher than the one I had in mind. I think our estimate was closer to $9 billion of government expenditures that would send that strong signal that this economy has to transition to a net zero economy in the coming decades. And that includes, of course, the Net Zero Accelerator Fund and others. So I don't have in front of me the full list. I was looking more at the large amount. It's a big amount of money, bigger than anything we've seen before, and it's important. But again, our message is that sends the signal, but to get there, we can't get there through government expenditure alone. It's not going to happen.
And I know that in your testimony, you were kind of hoping to see $30 billion to the Strategic Innovation Fund. We're starting with 7. And if I misquoted you, I apologize.
Yes, no, that's not correct, but please continue.
Okay, so this budget includes a significant commitment of $7 billion to the SIF, which has been an effective program in helping businesses grow and innovate. Mm-hmm. How do you see the chemical and plastics industry making use of the $5 billion in funding for decarbonization of industry through the Net Zero Accelerator?
Well, that does provide some opportunities, and certainly we have had 3 major investments in Canada that have participated in the Strategic Innovation Fund to date, totaling proposed $9 billion, I believe. One of those was put on hold due to COVID. We'll see if it comes back. So the industry has experience with that. The $30 billion number I mentioned is how much investment we should have seen come into our sector. Total investment. Again, we don't expect the government to fund all the capital investments for our sector, but we expect it to create the conditions where that will come. What I was providing was a historical example. We should have seen 30 billion. We've only seen 7. It tells you we're falling behind. So there's an urgent need for measures. Again, the money in SIF, especially the Net Zero Accelerator, very welcome. We have companies that will definitely take advantage of that. My point being, though, it's a minority of the facilities in Canada. We have to create a business environment where we can recapitalize. Getting to net zero, we have to recapitalize not only our sector, the mining sector, and every other sector in the economy. And that means attracting domestic and foreign investment. It's a big job. And SIF expenditures alone will not achieve that, as important as they are and as welcome as they are.
Well, thank you so much for correcting me and correcting the record. My next question is to Mr. Kelly. Thank you for your testimony, Mr. Kelly. It's always fun to listen to your colorful testimony, I would say. You touched a little bit about the Canada Recovery Hiring Benefit and how you think that a lot of companies will find it useful as they transition out of other programs. And as the details of this particular program are still being developed, what elements are essential to ensuring its effectiveness? If you can provide some comments on that.
Sure, it is a very good program, largely designed on some previous programs that have existed in the past to try to get small businesses hiring again. Look, we predict at CFIB that as the economy eventually reopens, and Ontario is not making that easy, but when that actually does happen, businesses are going to need to start to hire back some of their workers, but they're not going to have the money to do it. It is going to be really, really tight for businesses that have been closed for month on end to try to find the money to when sales, we imagine, will trickle back, not flood back. So this incentive, we believe, could be quite profound if broadly available. And if the government puts too many restrictions on it, I think it will be, unfortunately, like so many government programs, more useful in concept than in reality. To that end, we urge the government has said that it'll follow essentially the same rules as the wage subsidy, so that you'll be able to access it if you've had a sales decline. That makes sense. We're not opposed to that. It shouldn't be there for businesses that have, their revenues haven't had any hit. They should not be subsidized by the government of Canada. That makes sense. But we do worry that if the if this could be a good transition to get businesses off of the wage subsidy onto the hiring incentive. And I think a lot of the design principles that have been put in place are the right ones. To the government's credit, they've also asked the Canada Revenue Agency to administer the program. And I'll issue a rare compliment. The CRA has been, I would say, one of the best agencies in government in ramping up programs to try to get them delivered to Canadians. The subsidy programs that have been administered by other government agencies, most notably BDC, have really been quite poor, whereas the CRA has done a good job.
Very quick question, Annie, and quick answer.
Okay, great. And thank you for that, Mr. Kelly. All our agents work really hard across all the agencies, but I know that CRA has done a phenomenal job. It's to Restaurant Canada, and it's with regard to lower credit card interchange fees. Can you comment on how these measures are expected to lower the cost of doing business, especially for businesses that are increasingly reliant on e-commerce?
I may ask Chris if you can provide a little bit more clarity on that.
Chris, go ahead.
Sorry, good afternoon, and it's a great question. I know interchange fees have been such a critical issue for a lot of restaurant operators. The big challenge, of course, is that a lot of times those interchange fees exceed what the profit would be off of the sale of that receipt. So sometimes those fees can be so extraordinary that operators actually spend more money and go into a loss because of that. So it's a situation where, especially at this time, where most operators are operating at a loss, that it's become a much more critical issue.
Okay, we'll end that session there, and we'll go to Mr. St. Marie, followed by Mr. Julian. 6 minutes, Gabriel.
Oui, merci.
Thank you, Wayne. So hello once again, everyone. Again, a very interesting panel. My questions will be for Ms. Lamont. Thank you for your very clear and well-constructed presentation. You showed that there were really some important measures that the government brought in to support startups, but you also raised certain criticisms, and I'd like to come back to that. So what specific measures, in your opinion, are missing from the federal budget for startups in Greater Montreal? Thank you, Mr. St. Marie, for your question. My goal in being here today is mainly to make people aware of the different reality of startups and the importance of government programs taking into account that reality. We saw that with the wage subsidy, the emergency wage subsidy, where at the beginning it did not take into account the reality of startups. We spoke out quickly and it was changed. And what I would like to see is a mindset in the government so that every time a program is brought in to support businesses, the question is asked, how can this help startups? And how can we improve the program to achieve this? As to what is missing in the measures brought in by the government, I talked about the hyper-growth platform. This is what we need to move on to the second phase for growth, to have economic spin-offs, as I said. What does this mean? Well, for startups, it's quite simple. They need financing, they need talent, and they need clients. And at the startup phase, there are plenty of services available to assist them. But once they've gotten through the first 2-3 years or so, they end up all on their own to move further forward, and it requires new abilities, new financing, new markets as well to be able to achieve that. So to build that platform for Quebec is essential. Otherwise, we'll stay with a startup ecosystem of small businesses, and that's not what we want. We have a lot more ambition for our startups for what's to come. That's one point. The other point I talked about was clients, and the government can be a remarkable client for startups, but for this, of course, adjustments have to be made to its tendering procedures. They have to listen to startups and take the time needed to help them improve their technological solutions and adapt them to the needs of the government. Imagine if the government is a client of a startup and how much they're starting up with a remarkable business card after that to be able to go out and find other clients elsewhere and be able to build a reputation and having been able to achieve a contract with the Canadian government. So those are the 2 points that I would like to see improved. Thank you. 2 very interesting points. So hyper-growth platform for startups in Quebec or Montreal and facilitating access to tendering processes. It's duly noted. I hope it will be included quickly. My other question is, of course, the last year, 14 months or so, have been difficult for pretty well all businesses, especially startups, very difficult. How would you say that the situation has changed since the beginning of the pandemic? Have things improved? Have they deteriorated? What is the feeling out in the field? That's an excellent question. Thank you, Mr. Saint-Marie. At the beginning of the pandemic in March, there was a survey that was done, and 60% of startups had less than 3 months of liquidity. 3 months. So, of course, we feared the worst. But as of mid-April, we saw nearly 2/3 of startups had reviewed their business priorities and their business models. So that's the beauty of a startup, is their ability to turn things around, reinvent themselves and adapt. They don't have a heavy structure. They can do this quickly. We talk about turning on a dime, and that's what they do. So this is the capacity, also the strength of innovation, and that's how they get out of, that's how they're coming along in this pandemic. We're not seeing a huge decimation. We're seeing new opportunities created by the pandemic, new opportunities, new projects in medtech in Montreal, because people are looking for solutions to new problems that we're experiencing in the pandemic. So we see solutions to help restaurants, for example, that they brought in to help them take orders and become a place for takeout food. So I think startups are going to come through the crisis well, but of course, these wage subsidy programs help a great deal too. So we look forward to see what will happen after, and that's where we'll have a better reading of the situation, I think. Thank you very much, Mr.
Thank you very much, Mr. Chairman. Do I have a little more time left?
Minute and 10.
Oh, très bien.
Very well. So a startup entrepreneur talked to us about the fact that in the budget, they didn't see the Innovation Assistance Program for the CNRC, and they were worried about that, saying that for the next few months, they were using these funds in order to continue to grow their business and have it operate. And they said it would be unfortunate if they had to close down just before they reached the finish line. Is this an isolated case, or do you hear that more? No, actually, I'm surprised to hear that. I thought there was additional funding made available, so I don't see that as an issue. All right, well, we'll look into it with him, but that covers my questions. Thank you very much.
Much to you both. We'll now go to Mr. Julian, 6 minutes, and followed up by Pat Kelly. Peter?
Thanks very much, Mr. Chair. Thanks to all our witnesses for coming forward with very compelling testimony today. And we hope that you and your families continue to be safe and healthy as this third wave hits. My questions to start, my first question will be to Madame Drigola, Mr. Kelly, and Monsieur Bourbeau, because we are in the midst of a third wave, as you have all pointed out. Every one of you have pointed out the importance of continuing supports. And we have a Budget Implementation Act that basically does a victory lap. Within a very few weeks, we'll see massive slashing of supports. It just doesn't make sense at this critical time. And we've had witness after witness attest to that the government seems to be crying victory far, far too prematurely. I'd like to know the consequences that you see in each of your organizations for businesses, for restaurants, if the government doesn't heed the call to amend the Budget Implementation Act and put in place measures, sector-specific and more general measures that continue to assist businesses, small businesses, community businesses, as we continue to fight this pandemic.
Woman first.
And go ahead, Mr. Bourbeau first. Go ahead.
Oh, woman's first, please.
Okay, we'll go to Mr. Cola.
Thank you. bring up an excellent point. The wage subsidy program, for example, we saw after the first lockdown helped about 50% of businesses who were using it hire back about half of their workforces. What we're seeing on the ground right now is very different than the message that's being presented to Canadians by government in terms of being very cautious about rolling back restrictions. Maybe we can have some outdoor activities this summer. Indoor activities, we have to wait until the fall. But at the same time, we're starting to taper back these programs that are so critical in helping businesses survive. Without a question, these programs are excellent. The government did a phenomenal job in getting them out quickly, adapting them in response to what has been happening on the ground, to all parliamentarians in voting them in favor of them and getting them implemented very quickly. So they work. We know they work. As you mentioned, there's organization after organization that has come before you saying the same thing, that these really need to be maintained at their current rates through to the fall and probably even beyond for the hardest hit sectors that have that longer runway of recovery, because they will see restrictions lifted at the very end of the pandemic. So absolutely these rates need to maintain. Without it, we'll see thousands more businesses close and millions of jobs lost.
Mr. Kelly.
Certainly agree with that sentiment. Look, as I said in my presentation, the average small firm has inherited $170,000 in COVID-related debt. We're projecting at CFIB 180,000 permanent business closures as a result of the pandemic, and that data was collected prior to the third wave. So I suspect both are far worse than that. The only thing that's going to make a meaningful difference is if governments can themselves, federal and provincial, take on some of the debt that small businesses are grappling with. The recovery is going to start with allowing businesses to reopen their doors, many of them that have been shuttered in retail, hospitality, the service sector, arts and entertainment. But that's only step one. Step two is ensuring that these businesses that we can go back to asking Canadians to return to these very businesses. And until stay-at-home orders and the advice to Canadians to stay home and avoid going out ends, we cannot start to pull back on these subsidies. It was the Deputy Prime Minister herself who said it would be monstrous not to provide supports to businesses when, through no fault of their own, they are being asked to close. And the government's pulling that back too fast.
And from Restaurants Canada?
Yes. We understand that the government would like to stop the wage and rent subsidies in September because this is a target for vaccination to be completed. That said, since the restaurants will reopen maybe at the end of summer or gradually in September, it does not mean that we operate at 100% because with distancing, we operate at 50, 60% maybe. So we are not, an average restaurant will not go back to profitability before at least 12 months. Which is why we definitely need that support, not only not to phase out, but to be extended until April 2022.
And you see 50% of restaurants closing if the supports are not put into place.
That is correct. As we speak, half of the restaurants are at risk, at high risk.
Merci beaucoup, Madame Lamond.
Thank you very much. I would like to ask you the same question. What are the repercussions on the startup ecosystem in Quebec and elsewhere in Canada if the federal government dramatically cuts the various subsidies and assistance as the federal budget indicates that they intend to? So what will the impact be? Well, it certainly creates risk for them because, like other small businesses, I think, I'm not sure who made the comment, but I liked it earlier, and that is that the main thing to focus on is the drop in revenues, and that's what we're going to have to look at, and we have to fill that gap because once the subsidies end, the sales won't necessarily be there to compensate. A number of startups have difficulty finding other sources of revenue.
You all in that round. We'll go to Pat Kelly in a 5-minute round, followed by Sean Fraser. Pat?
All right. Well, thank you, Mr. Easter, and I will address my questions, I think, mostly to the other Mr. Kelly with us today. And on the I'm really glad that you mentioned the small or the response to new businesses or lack of response to new businesses so stridently in your opening statement, because this is something that all opposition parties have raised repeatedly at committee and in the House of Commons. Back in maybe February or March, I think it was, the Parliamentary Secretariat for Small Business claimed in a response to my question that they were just on the edge of coming up with a response for new businesses, and then nothing. Now they're back to just completely ignoring new businesses that have fallen through the cracks of all of the aid measures. So we're going to have questions in a moment from Mr. Fraser. He, as the parliamentary secretary, has been part of this just ignoring or pretending that there is something out there. Do you want to comment further about the way new businesses are not being reached?
Yeah, this has been a giant issue right from the very start of the pandemic. And I will say, I do believe that most members of government, most ministers are quite sympathetic to this. All of them have said to me many, many times that they're working on it, they're thinking about it, they need a solution here. But it does feel like the energy in fixing government support programs for small businesses has ended. There was good energy in the fall, especially when the Deputy Prime Minister took the reins in finance. She did fix many of the gaps in some of the programs that she inherited, and so there was progress being made. But that when the new year hit, it feels like the federal government said, "We're done. Businesses, you've got what you are. Yeah, we'll renew these programs a little bit longer, but
just
that's
hang in there."
And you know, whenever there are huge swaths of the business community, not just those new businesses, but others too, that when they hear the Prime Minister and others say, "We've got your back, small business owners," it really burns them because they are not getting any of the support that they need. And I will say, I mean, it's not just the federal government. Provinces too have been, there's lots of holes in all the provincial programs, including those run by Conservative governments, but we've got to fix them. This is an emergency, for goodness sakes.
In some of the responses that we've heard when raising the question of businesses that have fallen through the gaps, either because they were brand new enterprises in March of 2020 or for other reasons, they are directed to programs that they still don't qualify for the same reasons that they. So can you comment on that?
Yeah, so look, I understand an MP wants to provide a constituent with an avenue that might work for them. So you know they don't qualify for the wage subsidy. Well, apply for the CEBA loan. The business owner then spends a week trying to sort through all the details of the CEBA loan program to discover they're also not eligible for that. Then they go to the rent subsidy, and then they go to the HASCAP program. And it's been really, really painful for these businesses. They've come to us. We took last year over 80,000 calls from small business owners trying to provide them with some guidance into the support programs that work for them. And look, there are lots of good programs and businesses have gotten a lot of aid. 70% of our members said that it would have collapsed by now had the federal government not created some of the programs it did. But we can't just be satisfied with that. We've got to fix the programs. And even now, this late stage in the pandemic, if we can get some money to these new businesses, they have a greater chance of being able to survive because that debt has not gone away, allowing them access to some of these programs. And we've laid out some detailed possibilities for government to consider. That would be super, super helpful. And I'm really begging you as parliamentarians to put pressure on the ministers to make this happen.
Good question, Pat. The chamber has talked about the necessity of a reopening plan. Parliament debated a motion on compelling the government to table a data-driven plan for a safe and permanent reopening of the economy. You support this, and I presume, but can you either tell us that you agree this is important and talk about why?
Is that directed at me,
Yes.
Mr. Kelly? Okay.
Go ahead.
Yes, we in fact did sign a letter with the Canadian Chamber of Commerce, the Business Council, the the Aboriginal Business Association of Canada, and 60 others. Bob, I think you're on that letter too. We've got most business associations in the country signed a letter urging the federal government and provincial governments to lay out the roadmap. Quebec has laid out, I'd say, a decent roadmap to getting its business community open. Saskatchewan has done the same. Ontario just tabled a terrible one earlier today. But we've not heard anything from the feds other than a few broad messages. Canadians and Canadian business owners need to hear about the light at the end of the tunnel, what we are going to be able to do. We know we can't hold government to the letter or the date to the T, but giving us the broad direction would be immensely helpful for businesses to make decisions.
Thank you both. And I've read the letter 10, and we met with some American senators this week. Mr. Fraser, followed by Mr. St. Marie.
Thank you, Chair. My first questions will be for the Canadian Chamber, and Mr. Gill, I'll start with you. In response to Mr. Fass at the outset of the question and answer period of this meeting, you indicated there was no fiscal anchor, in your opinion, in the budget. In one of the introductory sections of the budget, I'm just going to read a piece of it here. It says, the government is committed to unwinding COVID-related deficits and reducing the federal debt as a share of the economy over the medium term. This fiscal anchor will continue to protect Canada's low debt advantage so the borrowing costs remain low and future generations are not burdened with COVID-19 related debt. Earlier this week, before this committee, the former governor of the Bank of Canada, Mr. Poloz, described it as a credible fiscal plan in which the level of government debt relative to national income stops rising and debt service costs are manageable, meets the minimum, or we should say perhaps technical standard of sustainability. I draw your attention to the table on page 328 of the budget, which shows these criteria are met. He's talking about that same fiscal anchor, a declining debt to GDP ratio over time. Is it the view of the Chamber that declining debt to GDP ratio is not a fiscal anchor?
The Canadian Chamber acknowledges that the budget sets out a plan to reduce the federal deficits over the medium term and welcomes that the fiscal projections have been brought forward once again in this upcoming budget. From the Chamber's perspective, having that fiscal forecast and those guardrails in place are highly desirable. We had just pointed out that it would serve warranting a more concrete fiscal anchor in which to tie debt to GDP ratio in the future, as some other provincial governments have done.
Look, I'm not trying to be tricky or to put you on the spot too hard. It's just that the declining debt to GDP ratio was the pre-pandemic fiscal anchor. Is it your view? I just to reiterate the question, I found it a little difficult to discern. Is it your view that a downward trending debt to GDP ratio is not a fiscal anchor?
No, as stated before, from the Canadian Chamber's perspective, that is a fiscal projection and a worthy one.
Okay, well, look, I'll stick with the Canadian Chamber. I can't remember if it was you, Mr. Gill, or Ms. Dragola, who talked about the need for a reopening plan. I'm looking sincerely for your advice on this point. You described, I believe, the need to work with provinces and territories to outline a clear plan. And look, Mr. Kelly, if you've got advice on this point as well, I'd be happy to take it. One of the challenges that I come from Atlantic Canada, and we've benefited from I might dare say, a better public health response than much of the country. Although my province is currently in a lockdown, we're already seeing a very serious downward trend in cases, and look, knock wood, I hope it continues. I don't want to find myself in a position where we get caught up in trying to establish uniform criteria that would end up delaying the reopening for businesses that could be open potentially this summer and have customers keeping them alive rather than subsidies. Do you have advice on how we can establish safe reopening criteria that protects the advantage of jurisdictions that are able to open because the public health situation is perhaps not as severe here as it may be in other parts of the country?
Sure, and I'll take that one. You bring up a great point in that there are different realities across Canada. We are a very large geographic country. There's different scenarios on the ground depending on where you are. But what we're trying to avoid when we call for a national reopening plan is to have 13 different reopening plans for the country. What we saw during the pandemic with the lockdowns is that there were different lockdown criteria depending on where you were. So the same health metrics, the same indicators in one part of the country yielded different lockdown criteria or results than somewhere else. If you're a business and you are operating in different jurisdictions, you have several locations, it makes it very difficult for you. It also makes it very difficult for Canadians to look forward and plan and to have that hopeful guidance. There's also that piece of the travel reopening that we really want to make sure that we're working with our international counterparts to be able to safely and gradually reopen the border. It's not it's not either it's closed or it's open. There are, steps we can take. But again, what we want to avoid is having piecemeal or a patchwork of rules where if you're flying into the country, there's one set of rules with the hotel quarantine versus if you're driving in, there's a different set of rules. There's loopholes that can be used. We're just trying to avoid that kind of piecemeal. At the start of the pandemic, there was a really great Team Canada approach. Everybody was working together. That's what we're trying to have happen again right now. We've seen 3 different reopening plans released in the last week from 3 different provinces. Each one uses the same health metrics to have different opening criteria. Makes it very challenging for businesses to plan and move forward. So that's what we're really trying to avoid.
Okay, thank you. We're a little over time there. We do have a hard stop at 5:30 Ottawa time. So I'll take one question from Mr. St. Marie, one from Julian, and then we'll go to Ms. Jansen and Mr. McLeod. And I would remind people, look, Ms. Lloyd is sitting there just waiting to answer a question. Not many have went her way. Mr. St. Marie.
Oui, merci.
Thank you, Mr. Chairman. My question is for Ms. Lamonde. Can you give us a few examples of startups that are well developed and are success stories, and the impact that the cluster of startups can have on the economy, and then the hyper growth needs? Thank you for your question, Mr. St-Macky. A great example is Lightspeed in Quebec. We are all very proud of Lightspeed. It's a founder that came from BC and settled in Quebec, and he found it difficult to recruit enough talented staff and even went abroad to be able to grow to the next level. So what we want for super growth stages is to enable people to hire abroad if they need to until we have enough domestic talent so we can create that kind of expertise, and then a company like Lightspeed can help other startups to take the next step. So that is a great example of how we get that trickle-down benefit and the economic benefits that come from a success like Lightspeed. We have a lot of others that are on their way. Thank you.
Thank you. Thank you both. Mr. Julian, followed by Ms. Jensen.
Thanks, Mr. Chair. And I'd like to say to all witnesses, we've certainly heard your calls that the government moving to slash all of these support programs when we're in the middle of the third wave is not an appropriate approach. And I think all members will be reflecting on that when we consider amendments to this bill next week. I would like to ask my question of Madame Lloyd. The other crisis, of course, is the climate crisis, as you've said so eloquently, and you've talked about insufficient funding. Now, in my part of the country, the federal government is spending nearly $20 billion to ram through the Trans Mountain Pipeline project over the objections of Indigenous peoples, the local cities, the province. Do you not feel that given that insufficient amount of funding for the green economy and to deal with the climate crisis, that $18.5 billion so far would be much better spent in ensuring that we had the clean energy jobs of tomorrow and the green economy transition?
Thank you for the question. Absolutely, I feel that there needs to be more investment that's in the green economy. And the perspective that I'm here to share today is that I think too often the discussion focuses on big business, it focuses on technology, and it doesn't really address what the value is of engaging the vast majority of businesses in Canada, which are small businesses. So the conversation that we've had today is incredibly important when we think about the survival of businesses in Canada. If you can't keep your lights on or your doors open, are you really going to be thinking about reducing your carbon emissions? But I think what I'm encouraged by in the budget is that we're trying to address both short and longer term measures. And the reality is that we have a climate crisis that we need to address by 2030, and our emissions are going up. We're on the wrong side of this trajectory. So, what are the kinds of initiatives that we're investing in? And the purpose of my testimony today is to try and encourage all parliamentarians to be thinking more broadly at the way that we're approaching climate action. This issue is not going to be solved by just a handful of people that are working on this. It's not going to be solved by miracle technologies. They're incredibly important and a critical part of the plan. But the Climate Choices Institute, which is a federally funded independent think tank, put out a report that said the pathway to net zero, 66 to 90% of the emissions that we need to achieve by 2030, those solutions exist. What we need is for people to adopt them. And small businesses are a critical component of making sure that we can do that. And at this critical juncture, when they are rebuilding, the important part is that we're not building back to business as usual. We're building in a way that's going to make them more competitive and resilient for the future. Small business on their own right now, even startups, wouldn't it be wonderful if startups, as they're thinking about growth and building businesses of tomorrow, have inherently built in considerations of how they're going to do that in a way that is a low emission strategy. It's not just about building, green products and services, but about operating everything the way that we do in a way that does low emissions. And that's sort of what I'm advocating for here.
Okay, we will have about 3 minutes each for Ms. Jansen, and Ms. Zerowitz is going to wrap it up now. Ms. Jansen.
Okay, thank you. Mr. Kelly, you've begged us as parliamentarians to urge the ministers to consider those who have fallen through the cracks, small businesses, startups, as you mentioned, obviously hospitality and restaurants and so forth. Now, I had that opportunity last week with Minister Freeland. She came and I asked her a question on behalf of a constituent here who's a restaurant owner locked down right now. And the question was, he wanted to know why the programs made no differentiation between those who were seriously impacted and those who were not. He wanted to know why small business owners like him, who were shut completely, were treated the same as those who were open. And unfortunately, her response was, as you can already imagine, that compensation has been very focused on where the need is greatest. And we just keep hearing this refrain over and over that the compensation is covering everybody, nobody's falling through the cracks. How do I get that through? I tried, I did my best. What else can I do?
Well, the same as me, and that is to just keep saying it over and over again, because look, everyone's attention is on vaccines and ending some of the restrictions that have started across the country as it should be. But there are some, just as there are horror stories from a health perspective, there are so many horror stories from an economic perspective for small business owners. Every single day, I talk to a business owner who is right now in the process of losing their home because it was mortgaged to start the business. Every day, I talk to a business owner that has bled their entire retirement savings in order to try to keep their business going. Our initial evidence shows that government support programs, as positive as some of them are still representing less than half of the overall losses that most businesses are experiencing. And we're giving them a legacy of debt, removing their wealth. And we've just got to keep pushing to try to fix some of these gaps. There are lots of businesses that are getting help, and I'm pleased with that. But so many others have not, and that the economic consequences are going to be with us for months and really decades to come.
Yes, thank you very much for banging that drum. I will continue to bang that drum. I know that Mr. Borbos, has spoken to the fact that these restaurants can no longer take on more debt. And my constituent was very clear. He cannot afford more debt. And yet, this is where he's at. And so I don't know if Mr. Borbo has any suggestions. Again, how can I get the news out that the programs are not helping those who are most impacted?
Mr. Borbo.
Yes, you highlighted an important point when you talk about loans over loans over loans. We know that the federal government, the government, they tried to help. ASCAP is an example that they want to provide health support, but there's no forgivable part, and there's a 4% interest. So this is not. This does not apply to the highest hit sector and to small and medium businesses.
Thank you. Final 3 minutes to Ms. Zerowitz. Julie?
Thank you so much, Mr. Chair. And I want to thank everyone for their excellent presentations. I wish I had more time, but I'm going to direct my question to Ms. Lloyd, who's been patiently waiting. Ms. Lloyd, I think I understand and appreciate more than most of the amazing work that Green Economy Canada does. In my youth, I co-founded an environmental group called Project Neutral. We were trying to ensure that neighborhoods, including businesses, small businesses, actually move themselves towards carbon neutrality. So I have a huge appreciation for the work that you do and very much appreciate some of the recommendations that you made. In Budget 2021, there's a couple of elements that I wouldn't mind reading out to you, and I would love to get your response to them. The first is Budget 2020 proposes to reduce by 50% the general, corporate, and small business income tax rate for businesses that manufacture zero emissions technologies. So I wouldn't mind if you could talk whether or not you thought that would be helpful as part of your work and trying to sort of engage small businesses to reduce emissions. The second part is the government is going to undertake an analysis to ensure that Canada keeps pace with the US and other jurisdictions in providing appropriate tax structures and incentives to encourage clean economy businesses to invest, grow, and deploy solutions here in Canada. On that one, I wouldn't mind if you could say, is there another jurisdiction that you think is doing a fairly good job? And if there are specific elements that you would suggest that we should consider as part of this analysis?
Thank you for the question. I'll be brief. I know we're at 5:30. Project Neutral, by the way, is a great partner of ours, so it's neat to see the connection. In terms of the first piece around the 50% tax break, I do think that is a really good element there. I think it will help to keep businesses here. One thing that we do here is that the incentive to go abroad and start businesses in Europe, for example, is pretty high. So I think that's a good measure. The challenge that I see with that is that the vast majority of businesses in Canada are not clean tech businesses. And so while it is an important part of seizing a new economic opportunity that's going to come with the transition to a net zero future, it just leaves out a whole bunch of businesses who can be reducing their own operating costs and getting many of the business benefits from greening their operations if there were other incentives that were available should businesses that are non-clean tech businesses take on certain measures. In terms of your piece about the jurisdiction, I am actually not the best person on my team to answer that, but I can definitely do a follow-up and get you some information. There are some resources I can point you to on that for sure.
Well, anything that would be helpful to us, I think it'll be great because, again, ultimately, we do want to help small businesses reduce emissions. So any advice or elements that you could provide would be great. Thank you.
Okay, thank you, Ms. Lloyd. If you have anything in that regard, just send it through the clerk, and he will get it to committee members. Look, we always run out of time. And I tend, this is our fourth panel today, and what I do to try and keep track of the comments I think are good, I just note down the time it happened, and then I'll go back to the transcript. Thank goodness for transcripts. And my paper is full of about every 5 minutes all day over 4 panels. So look, we've had a great series of witnesses. We've had constructive criticism. We've had some praise. It goes all over the map with good ideas for the future. Not all on Bill C-30 for sure. But look, thank members for their endurance during the day, and thank all the panelists for their great presentations and taking the time to answer our questions. So with that, we will see committee members tomorrow again. And we'll adjourn the meeting. Thank you very much. Meeting adjourned.
Thank you, sir. Stay well.
Thanks so much, everyone. Thank you.